Three Zoom meetings
without
live now, Chair.
yesterday.
Right.
Sorry about all this.
Okay then, Eleanor. Right. Good morning to you, and I would like I'd like to welcome all councillors, officers, and members of the public viewing on YouTube to this meeting of the Children, Adults, Health and Wellbeing Policy Developments and Scrutiny Panel. My name's Councillor Vic Pritchard, and I'm the chairman of the panel. I will now call out the names of other members of the panels to ask them to confirm that they are present. Councillors Michelle Adossery.
Present.
Councillor Jess David.
Present.
Councillor Ruth Malloy.
Present.
Councillor Bharat Pankhanari. Badly pronounced, I'm afraid. Not present. Councillor Mark Roper.
Present.
Councillor Andy Waite.
Present.
Councillor Paul May.
Present.
And Councillor Eleanor Jackson. Eleanor?
Yeah, I'm here.
Right, excellent, thank you. The panel also has 3 co-opted members, and they are David Williams. He's not present, is he? No. Councillor Chris Batten. He's not Councillor Chris Batten, and Kevin Burnett.
Present.
Thank you. So we're missing David Williams and Chris Batten, and also Councillor Bharat Pankhanari. Right, thank you. Now, this meeting is being held under the local authorities and police and crime panels, coronavirus, flexibility of the local authority and police and crime panel meetings, England and Wales Regulations 2020. The Council has agreed a protocol to cover virtual meetings, and this meeting will operate in line with that protocol. The meeting has the same status and validity as a meeting held in the Guildhall. I can remind members and officers to keep background noise to a minimum, to only speak one person at a time and not to speak over others. Please mute your microphones when not speaking and then unmute when I invite you to speak. Please indicate if you wish to speak by using the chat facility on Zoom by typing MIS, may I speak, and I will call you to speak in turn. If a member of the panel has to leave the meeting, then please draw my attention to this by using the chat facility. If you subsequently return to the meeting, then please also draw my attention to this in the same way. Members should also inform me if they lose connection and miss any part of the meeting, as this may result in them not being able to vote on any item they did not hear in full. Should the panel need to take a vote in order to expedite a result, I will assume a majority position. So if you wish to abstain or vote against, please indicate this in the chat when moving to the vote. Are there any questions of panel members? Right, then I move on then to item 2, apologies for absence and substitutions.
Thank you, Chair. Yes, we've got apologies from David Williams, one of our co-optees, Chris Batten, another co-optee. Councillor Liz Hardman has given her apologies today, and she has been substituted by Councillor Eleanor Jackson, and we've had apologies in from our Corporate Director, Mike Bowden, for this meeting.
Thank you. Item 3 then, declarations of interest. Are there any declarations of interest, please? Any declarations of interest? Paul, I believe you have a declaration of interest.
Yes, thank you, Chair. I'm a non-executive director on the board of Sirona, and that's coming up in the agenda today. And I've made arrangements when that item comes up in discussion, I will leave the meeting and go into away from the meeting to do that. So that it's technically possible for me to declare that interest and go. Thank you, Chair.
Right, thank you. Item 4, urgent business agreed by the chair. There is no urgent business, so we move on to item 5, public councillor statements and questions. Shiva Page has submitted a question to the panel as follows. Is it accepted and usual practice for an employee in the CCG who is a commissioner of a service to advise said service to withdraw a particular service from a service user? Now, there's a written reply from Dr. Bryn Bird, so you've always had sight of that reply, so I think we'll leave it that as it stands at the moment. Is that in order with the panel? I don't see any dissent, so we'll take that as read. We move on then to item 6, the minutes of the meeting held on the 10th of March 2020. Can I take that as a true and accurate record? I see no dissent, so I'm going to take that. And then there's a question of matters arising, and there are a number of issues that I want to bring to the attention of the panel. And I'll take you first to page 6, and it states there that Kevin Burnett asked if any further information was yet available from the Secretary of State regarding the funding pressures in the education system. And the answer given by the corporate director was that he did not think anything had been received, but would he check? He would check on the behalf of the panel. Now, the panel haven't heard anything of this yet, so can that be brought back to the attention of the corporate director to secure an answer on that's for Kevin? That's one item. There's also Liz Hardman. She asked for confirmation as to whether maternity services in Portland will cease in April. Corinne Edwards replied that she would find out that information for the panel. Now, we need to clarify what the situation is on that. So again, can that go back for further consideration? Are there any other points that the panel would like to make on matters arising from the minutes? Andy.
Thank you, Chair. Yeah, there's on page 15, I asked a question about the breakdown of the budget. There seems to be some confusion about when the debts would be eliminated and we come into a budget surplus. And I've had no response to that question.
Right, so again, we'll put that back to officers to secure an answer.
According to the minutes, the Director of Adult Social Care was going to respond.
Right. Oh, right. Les.
Thank you, Vic. Thank you, Councillor Waite. The Virgin budget is under review at the moment. We are looking at some issues around supplier relief as well, because of the COVID period and because of the change in delivery of some of the services that have been running. We have the next meeting with them in September when we'll have a clearer position on the in-year budget. So I'll be able to report back at the next panel. Is that okay?
No, that would be fine then, and it does secure, confirms an answer to your questions, Andy. Is that in order with you, Andy? Are you comfortable with that?
I don't think there's a lot of choice, is there really? So yeah, of course.
You'll
okay, right.
Councillor Waite, you'll be due an update anyway from the commissioners in terms of the Virgin performance, because we committed to do that following on from the last meeting. So we'll make sure it's fully covered in there.
Okay, so with that, then we'll bring the minutes to a close.
I think Councillor Jackson wanted to make a comment. Just check,
right,
please.
Sorry. Eleanor.
Hello, can you hear me?
We can, yes.
Right, I've got a couple of questions. Firstly, I'm very ignorant. What is Operation Encompass, which is mentioned on page 6? And secondly, on 7, page 7 that is, there's reference to needing to fill posts. And I'd like to know if the posts have been filled. And on page 8 to wanting 1,000 members for the panel, and they'd only got 400 at that point in time. I wondered if they got nearer to their target of finding 1,000 people for this panel that's referred to on page 8.
Les, are you in a position to answer any of that?
I will answer what I can. So in relation to Operation Encompass, I think you're referring to the conversation on page 6. Eleanor, is that correct? And
that's right, but I don't know what it is.
No, certainly, Councillor Burnett, you might want to come in as well on this because I know you're particularly cited on it. It's my understanding is it's a mechanism where the police report direct notifications of domestic abuse situations to the schools that the children are in. It's a software package almost where the police have direct, doesn't have to be a software package, but there's a system where the police have direct contact with the school rather than having to come through children's social care, who then have to pass the information on to the school. And in some places across the country, that is in place by the police force area, but in Bath and North East Somerset, that across Avon and Somerset Police, I should say, that isn't the case at the moment, though there are clear arrangements in place to notify schools, but we are dependent from children's social care on the time that we get notifications from the police themselves. Councillor Burnett or Mary Curley-Knowles, you might want to add to that, but that's my understanding. That's in relation to the first point, Eleanor. Councillor Jackson.
Thank you very much.
We'll do it one point at a time. Let's clear this one out. So, Kevin, you might like to comment.
Yes, only to say that I mean everything Leslie said is perfectly true, and the main point was really that the schools receive the information before children come in first thing in the morning, and the teachers and head teachers are prepared in advance if there's anything that's gone on, and obviously can help the child appropriately. We've been pushing for some time, and I know that Leslie and the safeguarding new unit now are on it, as it were, and planning it in with the police. So we look forward to it being up and running very, very shortly.
Excellent. Mary, do you have any comments?
Thank you.
Thank you, Vic. The only, oops, put my video on. The only thing additional I would say is that we're continuing to work closely with the police through the violence reduction unit as well, in terms of any other information that may be known to the police that we could look to share directly with schools. And when we've got some further information on that, I could prepare a briefing for colleagues.
Thank you.
I'd really appreciate that.
Right, that would be good. We'll hold you to that then, Mary. Thank you.
Thank you.
Now, Les, there's 2 other questions. Are you? Can you remember them?
Well, I believe one was on page 7 and one was on page 8, and the first one on page 7 was about staffing, but I'm struggling to find where it is.
Hang on, I'll get it up.
You're still in the process of recruiting for the registered nurse role. That was the CCG update, Bryn. I'm not sure whether you can respond to that or whether we need to take that away.
No, I haven't got an update on that, Leslie, I'm afraid, so we can take the response.
So we'll have to take that away.
It's the second paragraph.
Yes.
We are still in process of recruiting for the registered nurse role. Did you manage to recruit somebody?
Bryn's just answered, Ellen, Councillor Jackson. We need to go and take that away to find out.
Thank you.
Answer
Right.
that. And then there was a further question, I believe, which is also, Bryn, I'm not sure whether you're familiar with this either. It's about Our Health, Our Future panel, where it says after 4 weeks of recruitment activity, we've signed up around 400 panel members, well on our way to our target of 1,000 members. And again, I'm not sure on the update of that. We'll need to get that unless you are, Bryn.
Yeah, no, sorry, we haven't got an update on that, so we can take that away as well.
Thank you.
I will take an action now to follow those up, and I'll include Mark Durnford in the email trail so that can be responded to directly in advance of the next panel as well, so you're not waiting. Is that okay?
That'd be excellent.
Excellent.
Thank you.
Thanks very much, Les. So, right, we'll move on then to item 7, Cabinet Member Update. So we've got both Cabinet members with us. This is one of the opportunities that Zoom presents for us. We don't get any absenteeism from our Cabinet members. So who wants to go first then, Kevin or Rob? It looks like
You want
it's
age
gonna be
before
Rob.
beauty?
Rob, can you?
So it is age before beauty then. All right. I think you've been supplied with an update. Do you want me to run through the update just for the records?
Well, if you can just make highlights to what's been what you've recorded there. We don't want it verbatim, but if you any highlights in that and anything else you'd like to add.
Well, okay. I mean, the first section I've just given you a brief synopsis of the impact of COVID, and the one thing I will point out that I mean it has been an extremely challenging time for not only this particular portfolio but also our community. And the one thing that has come out of it is the way that the community have come together and the organisations have worked together. The council and the CCG historically have got a good working relationship, and many years ago when the decision was made to integrate the health and the care side of things, it certainly showed that was a good decision for our community. But then there was other elements that came into play on that. Our third sector group with the Compassionate Community Hub really came together and provided a lot of support for our vulnerable people and vulnerable groups. And a key player in that piece of work was actually Virgin Care, because they've come in and they provided quite a lot of support to that piece of work. But while doing that, they still maintained their focus on delivering many of the 200 services that we tasked them to deliver, and they found innovative ways of actually contacting and keeping that connection with many of the people that needs the support from those services. So I'm very happy with the way that's worked out. As a result of COVID, the government almost at the last moment has tasked us to create a local outbreak management plan, a LOMP. And again, Dr. Bruce Lawrence, who is our Director of Public Health, and his team has brought together quite a comprehensive document, which is quite wide-ranging, which puts us in a much better position that should we actually encounter another outbreak of certainly of the magnitude we've just experienced, that we actually will hit the ground running. And we've certainly learned from some of the challenges we've had this time. And now that has actually been adopted by the Health and Wellbeing Board and also endorsed by the Cabinet. Finally, I just really want to just highlight one particular piece of work that was actually in progress before we hit COVID, and that was the care and support charging financial assessment framework. That has actually been pretty much implemented through the process, and I think it's a testament to the focus and the work of our officers, and Anne-Marie Strong and Leslie Hutchinson have really proved that the focus on the detail of the of what we were attempting to do actually paid off. There was a big consultation process and everything like this, and there's obviously been queries in there, but we've had no major issues that have actually derailed or caused us any concerns on that way. So I'd just like to thank the officers very much for their focus on that particular area. And other than that, I'll be quite happy to take questions.
Right, thank you very much, Rob. Do the panel have any questions for Rob?
I think that Eleanor has indicated that she'd like to speak.
Right, Eleanor.
Yeah, I just wondered if the Cabinet member was aware of the contribution that
Sorry, can you hear me now?
I can hear you, Eleanor.
Right.
Right.
If you're aware of the contribution that
independent pharmacists, small family, and also the bigger ones have made to keeping things running with routine prescriptions, deliveries, and so on.
Thank you, Eleanor. Yes, and not only did I hear you, I hear you in stereo, so that was quite good. Yeah, absolutely, without doubt, the pharmacists were an important part of that support structure, and many pharmacists not only did their own delivery offerings, but also they worked with the Compassionate Community Hub to enable people to pick and deliver medicines to those that were shielding. So yes, they played a very important part of the whole jigsaw.
Right, excellent. Any further questions to Rob? The charging regime, I'm particularly happy that that's turned out positively, because it spills over from the previous administration to this one, and there hasn't been any hitches, as you suggest. So that's good news indeed. Thank you, Rob. We'll move over then to...
Thank you, Chair. Oh.
I think Councillor David has asked to speak.
Oh, right, sorry.
That's right. Thank you. Thanks, Rob. I just wanted to ask if you could comment on what the kind of main challenges are looking ahead to the winter months in terms of our public health responsibilities.
Well, certainly, I think our biggest, we have two challenges, really. One is the general complacency that we can actually drift into because we've adapted to the changes, the way we live our life, the way we do our simple tasks, you know, like queuing in the shops and everything like this. And that's become actually quite normal. And because we've been fortunate for varied reasons why we have had low numbers here, we shouldn't take our eye off the ball and think that we're not going to be exposed to our winter pressures. Now, we don't know what those will be. I know that the hospitals and the CCG and all those players are preparing. I've asked the question about PPE because I think that's been a challenge through the whole process, where we're very fortunate now that we've got strong support in for, let's say, our care home area, where you know they have the ability to come to us if they're finding it go very close to the line in terms of PPE. You know, we do expect them to source it themselves and things like this, and we know the hospital is working on almost a just-in-time basis. Now that is something that they've not chosen to do. It's something that nationally it seems to be the picture. And it then raises the question, if we do actually have a spike, have we got any backup, or how are we going to manage that backup to cope with that? Because what we don't want to do is have people with the inability to look after these people without keeping themselves safe.
Okay, thank you, Rob. Are there any further questions to Rob? Michelle?
Rob, are we confident that nobody's been discharged from hospital into a care home without first being tested?
I believe in the early days that certainly wasn't the case, but the last I heard that they, when they leave hospitals, they actually go to the care home in the knowledge that they're not carrying that virus. I can get that reaffirmed for you.
Yeah, that'd be good, thank you.
Okay, any more?
Yes, please.
Right, then Paul.
Hello, Paul.
Hello, Rob. Can I just ask, there doesn't appear to be a full report from the Director of Public Health on the agenda today. Is that a policy decision that you've made, or just the sheer weight of pressure? Because the public health element is so important for the local authority.
I don't know if that's a question for me. It's what the chair required to come to to the meeting, Paul, but I do know that there has been quite a lot of activity with the Public Health Department, certainly doing the local outbreak management plan, and that's taken up a lot of resource and time. But I think you should really direct that to the chair, because I can't. There's nothing that's we wouldn't have actually said yay or nay to anything. I mean, if it was required, we would have actually supplied it.
I waited to let you struggle with answering that one, Rob, before I can come with the answer. The answer is, Paul, is that when the scrutiny panels were merged, children's services and adult services, the workload was so tremendous, we had to reduce some of what was past practice. And we used to have a public health updates regularly, as with the cabinet member updates and CCG update. And also we used to have a health watch update. So what we've decided to do is to try and to make it work better, is that we would have written reports from those two agencies if there was something that was profound enough to come to the panel, and if there was anything in those reports that was relevant, it would be brought to the attention of the panel. Ironically, we get COVID after that, so public health is of paramount importance. But I mean, it's the COVID has such a high prominence that it's there coming through other reports to the panel, so it's not being ignored in the least. But that's why we don't get direct reports presented to the panel.
I think Les wanted to come in.
Right, Les?
Thank you. I just wanted to add in about the question around testing. The government brought out some guidance, I think it was the week before last now, that are saying that all care homes, starting with those that are 65 plus, particularly with dementia, are going to have residents are going to be tested for COVID every 28 days and staff are going to be tested weekly. Certainly that's in place for the specialist homes. Nationally, that's been running out across from August onwards. So you'll see that all of our care homes will be tested. We've also put in place, there's a system put in place around PPE that for all the care providers, that they have sufficient supplies, and if they reduce less than 48 hours in their PPE supply, then they can come to the CCG and the local authority. So we are confident that we've got the correct systems in place, but that is enhanced now by the 28-day testing for the homes. And I'm pleased to report that with the latest ONS figures, we haven't had any COVID-related infections reported the week commencing the 3rd of July, I think it was the latest figure that went public today. I thought that just would be a helpful update, even though we haven't got a paper, it might help.
Yeah. Chair, could I just add something on about testing, and just for the records really. Our public health team secured a mobile testing unit that spent the last 3 weeks based at Odd Down Park and Ride. It had above average usage. I think it was doing on average about 100 tests a day. That has obviously now moved to another location, so it proved very effective for us. I mean, the average testing in other sites like Bristol Airport was less than that, so it showed that the people in Bath and North East Somerset embraced that. We have actually asked the question of our public health team to look to secure a MTU mobile testing unit at our universities at the appropriate time, just to ensure that we actually have that covered off should we need to undertake any testing there, just to be certain, because we are obviously taking in people from around the country, and some areas are maybe not as fortunate as we are in terms of a lower number.
Thank you. I see that the COVID is an issue in the report for the children's services and also the CCG. And Rob, you and your adult reports have made reference to COVID. And I think it would be appropriate to congratulate all of those people that have been involved in dealing with COVID in an official capacity, but also I think the residents of Bath and North East Somerset should be congratulated in conforming with quite stringent rules to try and to fight it. And I've downloaded the amount of cases of deaths in Bath and North East Somerset. And in the latest week, 29th of June to the 5th of July, there were no deaths in Bath and North East Somerset. There were none the previous week, and that extends back 5 weeks ago. We haven't had a death from COVID in 5 weeks. Testament to how everybody has played their part in fighting this disease. So I think that should go on record as well, because we are, like it or no, we are the best performing authority nationally.
But could I point out though, Chair, and you're absolutely right in saying that, but the virus itself has not changed. It still transmits, and so it's still vitally important that we actually take note of the guidelines in terms of distancing and washing our hands and everything like this. The virus has no boundaries. The only thing that we've managed to do is to contain it in terms of the way we behave and our distancing. It is still very much a threat to us.
Absolutely. You know, we must be complicit in all of what we do, but I think there has to be recognition that the public and all the agencies involved have performed particularly well. You know, as you say, it could resurrect itself, but as long as we conform as we've been doing, continue to, then we keep it at bay. So I'm going to move on now to
Chairman. I don't think I was. It's Paul May.
Right. Yes.
I'm not certain whether I got an appropriate answer. The cabinet member referred it through to you. I think the decision about the Director of Public Health coming on to this meeting is I understand that, but around COVID-19, I think we as a committee should be asking questions about the second wave and the preparations for that. And I don't think that was an unreasonable question to ask.
No. So are you implying, Paul, sorry to talk over you, but you're implying that it would be appropriate for this panel to invite the Director of Public Health to our next panel meeting to answer questions directly? Would that meet with the support of the remainder of the panel? It looks as though there's
definitely.
Yes, there's thumbs up. Yeah, right. So, Mark, can you record that, please? Thank you. So, thank you for that, Paul. So we'll move on now to.
Chair, sorry, I think that Councillor Malloy has wants to ask a question too.
Right, I'm covering two screens here.
Yeah, can I just quickly?
Oh, there you are, Ruth. Yes.
Yeah,
yes.
no, it was just about the testing of residents in care homes for COVID-19. And in principle, that sounds a good idea every 28 days. But my worry is, will that be, to be effective, that should be compulsory. But on the other hand, I don't think it should be, because some residents may feel uncomfortable about that. What if they're living with dementia, for example? Is it going to be voluntary or compulsory? That's my question. Thank you.
You answer that, Rob? I
don't think it's compulsory, because we can't force somebody to have a test. But I will leave, because obviously they have their own safeguarding and their liberties. But maybe I can ask Les to if she's got anything on that. If not, we'll come back to you.
I equally haven't got a definitive response to that, but I think the issues around people's liberty and the issues around people's human rights has been coming up in debate, and certainly it's been raised across the Principal Social Work Network and also across public health teams. So I think it's guidance, but I'm not 100% sure, so we need to just check. And certainly it's an offer that everybody could be, if everybody can be tested, that would be accepted. But you're absolutely right, Ruth, not everybody will want that or be able to agree to it.
Thank you.
Right, I'm trusting it would be in government legislation anyway, but we need it, how that interprets itself, to find out. So if you could do that, Les, that would be good. Now I'm going to move on, because we haven't got very far into the agenda yet. So Kevin, you've been sat in the wings waiting eagerly to present your report. So over to you then, please.
Thank you, Chair. Good morning, everybody. I'll keep it very brief. I'll be quite succinct. You nicely went on to thanking people for me, Chair, actually, particularly young people. Anybody who's got a family at home and is on this meeting or listening to this meeting will appreciate how difficult it's been for both parents, families and children during these difficult times. You know, it's been imposed upon them, and I think everybody in Baines has done a magnificent job. I'd obviously like to continue by thanking our social worker team who have managed to continue to look after our most vulnerable children in a really difficult time. And obviously the teachers often get overlooked, and the media have given them a lot of stick recently. Those teachers have kept schools going over Easter. They've worked above and beyond to create new systems that are hopefully going to be operational in September. And everybody should be aware on this meeting that not all children will be in school all the time in September, and particularly for our smaller schools, every child will be getting education, but maybe not for 5 days a week. There'll definitely be changes to come, unless there's some sort of miracle vaccine before September, which is obviously highly unlikely. With regards to our council team's performance, you may have noticed that our music service has gone fully online, and a lot of children at home have been having their music lessons online. So I'd like to thank that team. That is a brilliant piece of work. And obviously COVID-19 has had a massive impact on our finances. So therefore, we've had to rein in and tighten our belt a little bit with regard to certain services. But this administration has promised not to withdraw any preventative services. So we've been working very hard with partner organisations, including St John's Trust, to ensure that our frontline services, and particularly our preventative services, are maintained and crucially improved for our most vulnerable children. And last but not least, last week was a brilliant opportunity to speak to some younger people on a young people's webinar. They gave over their views and their thoughts, and they were extremely forward in their views, which was excellent. It's exactly what we want to hear from them. And I will encourage members of this board, next time we have a webinar with the young people's committee and group, then you join in and you ask them questions, because I think it's crucial that we make our decisions around their needs and their views. Thank you, Chair. I'll open up for questions.
Right. Any questions for Kevin? You've been more specific on congratulating people's efforts through COVID. I find it dangerous that you might leave someone out. And that's
I know.
why I do it.
I'm bound to have done. And I apologise to anybody I've left out.
Yes, indeed. So any questions from the panel toward Kevin? So Kevin.
I think
Kevin, you're on mute.
Sorry, I think Paul was first, Vic, if that's okay with you.
Thank you, Kevin.
Right.
I think that's the first time I've ever thanked you, Kevin. Thank you. Can I just ask a question, please, about schools? I asked a question at the Cabinet meeting, Kevin, about the disadvantaged community, and I think it's probably also within the question that Liz Hardman would have asked, about how, with over 80% of our schools now being in academies, there's a great risk of inconsistency in things like PPE and how we get those disadvantaged children back to school. Do you think that's something that this authority should be working more effectively with schools over, or do you feel that the academies have got the right professional support for the schools?
It's a very good point, Paul, and you know my views on academisation and privatisation of education. Obviously, this would be a prime example if everybody was under the same administration. The rules would be universal, and PPE, etc., would be universal as well. I believe the academies, where required, are asking our officers for help, and our officers are putting out information to the academies, and it's normally straight from government sources because the information is coming straight from them to the academies. And if the academies have got any direct questions, they can go straight to government or ask our officers. I know our current 11 maintained schools are all doing a fantastic job, and our officers are working very, very closely with them. But as you say, at the end of the day, it is up to the individual academies to arrange their own PPE, their own policies, etc., and make sure they're in line with government guidance And it is guidance, and it's not direct laws or directives that are given to these schools. So there's a lot of inconsistencies with the messages that have been given from central government, and that in itself creates inconsistencies in the way the academies approach and try and tackle the situation, particularly when they're trying to reopen in September. So overall, I would say our officers are doing a really good job, but you are right, each academy will have a slightly different approach when it comes to reopening in September.
I think, Kevin, if I could just come back, I can see Chris has offered to give some more advice, but it's about we're community representatives, and it's how can we actually make sure the fears of parents around children going back to school. I think even though we don't run the schools, which I agree with you is a great disadvantage, but I think it's the messages that we're firing out to parents. I think the council has an important role to play on that.
I agree. I'll let Chris come in there, if that's okay, Chris.
Hello.
Okay, Chris.
And great. Thank you for the questions, Councillor May, and thank you for the input as well, Kevin. As ever, it's good questions. And we are a local authority with a high number of academy schools, but I think the comment that I would make is over the lockdown period, we've continued to run a school standards board. So that's when the local authority and officers meet with all the CEOs of the multi-academy trusts in Baines, and we also meet with all the standalone academy heads. And I kind of feel like in some ways over lockdown, that's been a real opportunity to bring that board of people together closer. We've had more frequent meetings, and we've also had to deal with the same guidance that's been delivered by the government and work out how to implement that guidance. So there is part of me now that feels that actual school standards board does have a much more collaborative working arrangement. In fact, my meeting after this today is with the school standards board. Dr. Bruce Lawrence is doing a presentation on local outbreak management to all the schools. I've used that as a forum to promote what we expect as a local authority around supporting vulnerable children. In Baines, we had a very high number of children regionally who returned to school, particularly children who were looked after and children on child protection plans. So equally, I'd like the same as Kevin to thank all the schools in Baines, who I think have done an absolutely fantastic job in supporting the most vulnerable children. But just pick up as well on Paul's point around the disadvantage gap. And there is some concern across the region that some children may not have had access to education, either at home like they would have been able to do compared to other ones. The government has introduced some funding to support schools. We don't have the details of that yet, but there will be some additional funding that will be going to all schools. And at School Standards Board, I will be asking the question about how that's being used to make sure children are given opportunities to catch up. But equally as well, I have another meeting tomorrow with the St John's Foundation, where we're going to start to look at delivering the work around those schools where the disadvantage gap is the greatest. So I've got a meeting with a number of primary heads and CEOs tomorrow to look at that work. We will continue to support all schools to be ready for September. I believe all schools will be open. We are expecting all children to return. I think there will be some anxiety with parents, and as a local authority, we've been publishing information for parents on our web pages. We've also been publishing information in communications via our Connect bulletin, which goes out. What I will say is for the year groups who were due back in over the COVID period in primary, so reception 1 and 6, we've had a very high turnout of number of children returning to school. In fact, the Southwest has been one of the highest regions in the UK. But I acknowledge that there is still work to do over the summer holidays to get messages out to parents about the way that schools are preparing and measures that they'll be putting in place to ensure that parents and children feel supported. But the message is that at the moment we're expecting all schools and all children to return in September.
Good news. Thank you, Chris.
Thank you very much.
So, Kevin.
Yes, so thank you, Chair. Just a couple of questions, Kevin. That one was obviously it's great news that St John's Foundation are going to help and support in the gap that may happen after the council's recovery plan is going to impact on some commission services. I just wonder, please, when you might be able to confirm what commission services would be affected and how exactly that will impact upon them, so that we can sort of look at how schools will sort of come out of that.
Yeah, I can't give you an exact. I do have the list, and St John's have the list, but I'd rather not express that list at this particular point because St John's board need to approve that first. I've had verbal confirmation from them, and I've been allowed to announce their cooperation. But until the finer detail has been ironed out, I'd rather not say here. But the list that we gave them, they accepted every single point on that list, Kevin. So once I'm allowed to share it, I will make sure it gets to you and this board as well.
Great. So sorry, Vic, does that mean then that there won't be any particular impact that it was sort of predicted there would be on the recovery plan, but are you saying that they're going to cover that gap? Sorry.
Yes, there are some advertised posts that I believe may not be filled going forward, but every single piece of commission work that we looked at reducing, which was in regards to frontline services and preventive services, St John's Trust had agreed to fill that funding gap, and I believe Christopher, Mike, etc., and Leslie and Mary will be negotiating exactly how they step in to fill that void. And the conversations were very, very positive to the point where we'd probably look at improving those commission services with St John's Trust. But as soon as it's got through their board system, Kevin, then I will happily share that information with yourselves and the rest of the committee.
Okay. Any further questions for Kevin?
I think Eleanor, Councillor Jackson had some questions.
Right, Eleanor.
Yes, thank you very much for bringing me in. I'm very pleased with what I've heard from Mr. Wilford, because that actually covers one of the questions I wanted to ask for myself. I've got, in my slew of questions, as opposed to Liz Hardman's, I've got two issues. Well, three actually. Firstly, I've encountered several families where the only way they have of accessing the internet is on mum's smartphone. And I wondered what was being done about the children who just don't have the means to do the homework or whatever it is that's being set online, commendable though that is. I know in other areas of the country the take-up has been very poor. Secondly, I'm very concerned about the children around Radstock and area who attend Kilmersdon School, because this is, of course, is in Mendip, and we don't have any direct influence on the school, but nevertheless I'm encountering children who've had no education whatsoever since lockdown, their parents are saying, and it's very doubtful about Kilmersdon School being able to reopen because it's a very old building, and they say there are major health and safety issues. So my question is, what can we do for the Baines children who are being educated out of area, who are falling behind, quite frankly? And my third question is, I've just had a report from one of the providers of youth services, and I was wondering how we were getting on keeping in touch with vulnerable children who have previously been in youth clubs or attending our programs and so on. At the moment, in this area in Radstock, they're concentrating on outreach work, but is that the same across Baines, in Bath, and so on? You know, you see these clumps of teenagers hanging around and they're clearly bored off their socks. what can be done?
I think I think Mary's probably best to answer your last question, and Christopher's best to answer the first question. But I like to you're right in what you're saying there, Councillor. And another issue that's been brought up with me is children with multiple siblings, and they've only got one laptop, and they're all meant to be having Zoom classes at the same time. And that's proved ridiculously hard, particularly for parents that can't afford to buy several laptops or several iPhones at the same time. So that's a big issue. But I'll allow Chris and I think Mary to answer those two questions. Chris, do you want to go first?
Yeah, just on the IT access, the government has provided some IT for children who have a social worker, which included a router access to provide IT. But I acknowledge that potentially doesn't reach all the children that Councillor Jackson may be referring to. I certainly know from my maintained schools that some of the schools have done a fantastic job of preparing packs of all the lessons and all the support that they want to provide to children, and making sure that they're available for parents to pick up each day and collect and drop off. But I think the IT has been a challenge for some families, and it raises an issue around that IT disadvantage gap, and it's something that we'll need to continue to think about and work on for a wider group of children. Hopefully all our children will be back in school. The plan is that they'll all be back in school in September, but I guess in my mind we do need to think about, should we ever go back into a lockdown period, how do we think about those children who potentially have been missed. With regards to Kilmerston School, I don't actually know that school particularly, but I can certainly find out the details and numbers of children who attend from the Baines area, and follow up a little bit more with my Somerset colleagues.
So Mary,
well, I know that at Kilmerston School, 80% of the children are Baines children. It is a very good school and very highly regarded, but it seems to have insuperable geographical problems. Are you still there?
Yes, thank you. Yeah, I can follow that up, and I can certainly try and find out a little bit more about that school. It would seem, it would seem odd if they're not being providing the work and support for the children in the local area. I have to say it's not been brought to my attention during this period, but I can certainly look into it a little bit more.
Thank you.
Right. So Ellen, you had a final question that I think, Kevin, you were passing to Mary.
I think Mary might be best suited to answer that one, yeah.
Yeah, happy to answer that. Thank you, Chair. In terms of the services that have been running, and to also answer the question around the IT, I know that our colleagues in the Youth Offending Service and in our Connecting Families and our Children's Centres have also been supporting our vulnerable families, both in terms of access to food parcels and activities, but also where they've needed additional support about applying for grants for IT. And in terms of Youth Connect, my understanding is that Youth Connect have increased the range of support that they've provided to some of those young people, and they've been providing some additional areas, hotspot areas within the patch where youth workers are available. So I think it would probably be fair to say that each of the services have been trying to respond to those additional needs of young people who perhaps haven't been as engaged in school or activities as we may have liked. And the services are continuing to prioritise both face-to-face, Zoom, and a variety of ways of being engaged with those young people. But I'd be happy to take a question back to our Youth Connect colleagues and provide any additional information if that was helpful.
Could you do
well,
that?
That would be great, because I've only got a Soma Valley report, so I'd really appreciate that. Can I just throw in one of Liz Hardman's questions now?
Yes, indeed.
Right. How have the children's centres been operating during the pandemic? What face-to-face contact has been possible? Has it been possible to continue? And what has had to stop? What are the priorities for children's centres as services gradually reopen?
Shall I respond to that now?
Please, Mary. Yeah.
Yes, yeah, very happy to. So to confirm that the children's centres have remained open throughout this entire period, they have not closed at all. They continue to provide one-to-one support through doorstop visits, telephone, Zoom, and they've also been, where it's possible, doing visits using social distancing rules and with appropriate PPE. The children's centres have continued to deliver some online courses, such as My Time, My Space, and they've also had some really good feedback from parents who've also been attending an online course. The children's centres have continued to promote the health promotion campaigns, and they've been putting together lots of packages, of support packages. So portage pack, nature packs, not to 2 packs and activity packs, which are sent, either posted out to those most vulnerable families or hand delivered. They've also continued to deliver parenting drop-in sessions, and they've developed a guide working with families. I think it's fair to say the team have also been really, really busy in terms of ensuring the children's centres stay open so that social workers can facilitate family time sessions and contact, and also that health visitors use the children's centres as a base. So I think it's been a particularly busy time for the service. They've also, of course, been quite involved around the food poverty agenda, working with the COVID-19 team, and working with schools to ensure that food parcels get out to those most vulnerable families.
Mary,
that must be one of the most comprehensive answers I've ever heard. And I have tried to take notes, but I do hope Councillor Hardman's going to watch on YouTube later.
Thank you.
Mary, there's plenty going on, but are the children engaging with it?
Pardon me, sorry, Vic.
There's plenty going on. There's plenty of facility, but are the children themselves engaging with it? Or are there some that don't choose to engage still?
Yeah. So I guess in terms of children's social care, and in terms of our connecting families, in terms of all of the children's services, all of our social workers and family support practitioners have continued to work with all of our children and families through this period. Obviously, we had to look at our delivery model at the point of lockdown, so that only a small teams were physically in the office, so our duty team, and we centralised our visiting team. But we RAG rated all of our plans and our vulnerable families, and have continued to visit all of those families and to meet with those children and young people. One of the things that has been really positive in this period is our use of technology. And our young people have been really engaged around Zoom and WhatsApp and those various tools that we're all coming to grips with. And I would say that the support that we've had from Chris's team in terms of the virtual school, which is extended temporarily to cover children in need and those in child protection, has been really invaluable in terms of supporting our most vulnerable children in being back in education as well. That's been hugely helpful. And similarly, we've had huge support and cooperation from all of our schools in Bath and North East Somerset in terms of our most vulnerable children.
Thanks, Mary. Les, you wanted to come in.
No, I didn't. Sorry.
All right. Okay. That's
apologies.
fine. Right, Michelle.
We've got Kevin wants to speak.
Yeah, but I've got you before Kevin. Do you want to speak?
No.
No. Okay. So I'm back to Kevin. Right. I just wanted to complete that subject before we moved on to something new.
Thank you. Just a couple of things, Kevin, just to check up on. The first one was, were there any particular issues raised in your young people's webinar that you felt we should all know about, and any priorities that you took from the session to take forward? And the final comment really is just on whether you and the council can ensure that from the DFE that this issue about connectivity and IT actual hardware is actually something that will be quicker than soon, as they say, because I think certainly from the school's point of view, we're looking that the future will be blended learning. It will not be just face-to-face and back to the old. It's going to be forward to school, as they say now. And I think that it's vital for the vulnerable children and those families that may not be in that position, that there is something put in place sooner as we can.
Yeah. With regards to the second question, Kevin, I agree with you. And obviously, Chris has said that all kids will be back at school in September, but they will be back at school. I am predicting in a different fashion. I think there will be a lot of online Zoom style lessons, I think, and there'll be cases where schools may even have to close down if there's a COVID related incident and the bubbles aren't working correctly, etc. So there's a lot of obstacles to overcome. So the IT system needs to be in place for September, and I totally agree with that. And I'll let Chris answer with a bit more detail. With regards to the young people's webinar, I think the key point that came across to me in particular was young people's mental health, and that was brought up a lot by all the young participants. And I agree, during this lockdown period, they'll be saying when they're old like me, can you remember the days when we didn't go to school for 6 months? And I believe it's going to have an impact on a lot of children's mental health and how they were, their lives were completely turned around. So I think it's something that we as a local authority and nationally, we need to pay attention to and put a lot more resource into helping kids with their mental health. But that's what I took away from that meeting. Chris,
Mary, did you want to make a comment?
Yeah, I'm happy to give the other summary of the other areas in addition to what Kevin has mentioned. So the 3 other areas that the young people fed back on the webinar, one was around a focus on education, and within that, around transport to school safely, the education attainment gap, about how young people will be helped to catch up, the school curriculum, whether there could be an increased focus on the history of slavery, impact of colonialism and Africa before colonialism. So quite a bit around young people's experiences, how that could be included in the curriculum. In terms of support for the most vulnerable children and families, there was a request for support for families who had lost jobs, a question around summer classes for young people who may need a break from home, and mentoring for BAME children. And finally, in terms of young people's involvement, young people on the webinar are very keen to remain involved and included, and want every opportunity for the council to include them in the future. So those were the 3 other key items, in addition to what Kevin has already said in terms of young people and mental health.
Right, thank you, Mary. Rob Appleyard, do you want to make a comment? Rob?
Yeah. Sorry, Chair. I was multitasking. Yeah, I mean, I think Kevin's quite right about the mental health, especially the youngsters. But I think that is actually part of the picture, because I think we have mental health challenges across the cohort. When we've had people shielding and have that elements of isolation for sort of 3 months, and that it's had some major impacts on people, the way they feel and confidence and things like that. So I do believe there's quite a lot of awareness and work that's going to be undertaken in that area.
Right, Les.
Thank you. I was just going to add to Mary's point as well, in that we are developing the new Children and Young People plan that feeds into the Health and Wellbeing Board. And we've got a development session at the end of July. So we're in the 3rd year now of the 3rd and final year of the current plan. But when we've got the new plan in draft form, we'd like to bring that to the scrutiny panel as well, so that we can have a discussion about it. But it will include those areas that have been picked up here today and that Councillor Guy and others have referenced.
Thank you. Kevin, did you want to come back at all?
No, that sounds very full. Thank you very much indeed. Thank you.
Right, I'm going to move us on now, because all important these cabinet member updates, but they have actually they've driven a lot of questions, which is what is exactly our purpose. But I'm going to move on now to the CCG presentation, and I'm going to ask Dr. Bryn Bird to actually present, please.
Thank you, Chair. Good morning, panel. Yes, I'm going to highlight from update around the merger, and then of course also around the planning around COVID-19. So the BSW CCG, which is Baines, Swindon and Wiltshire, merged on the 1st of April 2020, and now compromises just under 1 million inhabitants, 934,000, including 94 GP practices. We have a clinical chair in post, Dr. Andrew Gerda, and a medical director, Dr. Ruth Graben, who's previously medical director in Baines. They were supported by 8 GPs on the governing body, in their governing body role, including 3 locality chairs. So myself, I am the locality chair for Baines as part of BSW CCG. We have an equivalent in Swindon and Wiltshire with Dr. Amanda Webb and Dr. Ed Rendon. So one of the key aims of the merge in operating scale is partly around efficiency and effective working in that respect. But there's also a lot about reducing the variation across the patch, upskilling those areas with best practice that can be found in all 3 regions, making sure everyone has access to high quality treatment. One of the key aims in the early part of the merger is the formation of an integrated care system, which we are tasked with forming by April 2021. And this will be assessed later this year by NHSE. So work is taking place currently in the format how this is formed. Okay. So at the same time as merging, also unfortunately fell the height of the response to the COVID-19 crisis. So the work we were doing alongside there, we were able to quickly form an incident coordination centre to oversee the health response. And this was able to form various new work streams to maintain our critical health services functioning during this difficult time. Now, there's probably a few areas to highlight in that as important in terms of how the CCG supported the health system. One is in primary care, so we're responsible for supporting primary care in maintaining vulnerable patients in their homes, enacting business continuity plans to help support the resilience, as well as improving the triage systems so remote working could take place. And one key element in Baines was the establishment of hot sites. So these areas that saw potential coronavirus patients only and kept them away from GP practices with the risk of infecting other patients and staff members there. It's been touched on already, but there was also a lot of support given to care homes. So they were identified as key high-risk areas very early on in the pandemic. And support included access to MDT working with help around medicines management, especially end-of-life care. There were daily and weekly calls into the practice from the Adult Social Care Commissioning team, and a lot of support around infection control management, including regular training and updates in the form of webinars, as well as virtual ward rounds. As well as this, in terms of our elective care management, we're able to gain support from the independent sector, so we could operate and deliver services to our patients virtually wherever possible. And also led by Virgin Care team, there was a lot of support given to the discharge planning, so we're able to get a lot of patients out of hospital very quickly in the pandemic, those with principally a social care needs. That was very important, enabling the hospital to free for the potential emergency and spike that was predicted. PPE was, of course, a local and indeed national high-risk concern very early on, and continues to be an area of focus. As part of the CCG response, we set up PPE cell to support providers across health and social care, and that included sourcing stock, purchasing PPE, mutual aid arrangements, especially with the RUH, and monitoring of stock levels. There's a lot of work around medicines management as well, especially, as you can understand, end-of-life care was very difficult during the pandemic in making sure patients had access when needed to these medications, and also the support and expertise surrounding their administration. So we were able to provide a lot of MDT support around that and guidance. Finally, before moving on, is working with the voluntary sector. So principally the setting up of the Compassionate Community Hub. So this was led by 3SG and Virgin Care alongside the local authority and the CCG. So they were able to reach out to the vulnerable and isolating, principally delivering food, medicines, urgent housing needs, mental health support and wellbeing, and also financial matters. So the hub has received over 5,000 calls to date, and the 3SG have managed to recruit 2,500 volunteers into the hub and have completed over 1,100 tasks supporting those vulnerable patients. So I think that's a key thing to highlight in this response. Okay, so that was during sort of the acute crisis. Now we're in a position where we're living with COVID, but also looking to restart and recover our services to manage non-COVID needs. So one of the key recognitions with that, whilst non-urgent care shut down in the height of the crisis, was how we go about the restart and not accepting, if you like, some of the pre-coronavirus models, but encapsulating some improvements that happened during the crisis in terms of collaboration of partners working together, but also the ways of working that become evident during the crisis, including digital working and earlier advice and guidance in patient pathways where appropriate. So this is something that we are continuing to do and enable as a key priority in the CCG. We're working closely on these messages, including social media, radio interviews, and online coverage. And there's been specific work streams around cancer, cardiovascular disease, mental health, and paternity. Okay, couple more things to mention. So one was the Nightingale Hospital. So in the predicted models of demand in this area, it was perceived that we'd need extra ventilation capacity for our patients. And so there was a 300-bed unit built in the French Aid campus in Bristol that Baines residents would have access to when needed. Now, as I'm sure most people know, very fortunately, those predicted peaks did not occur in the crisis, and it was not used as it was thought it was going to be. However, it still remains in place for any second waves and future spikes. So that's just for noting. Finally, was the response around Black Lives Matter and the BAME community that we have seen are higher risk than other communities of suffering the effects of coronavirus. So a couple of things to point out in response to the Black Lives Matter. We've worked with our partner organisations that are on the Health and Wellbeing Board to be proactive in response, issuing a pledge of support. Alongside that, in terms of responding to the risk to the BME staff, we have been strongly encouraging of risk assessments. So the staff members are working in a safer way, and that's recognising some of the disparity around how coronavirus is affecting the staff members. Okay, I think I will leave it there for now, and happy to take any questions.
Thank you very much, Bryn. First off, I'll take a question from Councillor Liz Hardman. I believe that Eleanor, you're going to deliver it. Eleanor?
Hi, can you hear me?
Yes.
Liz wanted to know when services at Poulton Hospital would return to normal, and I've got a sort of linked question with regard to cancer screening. When or if the normal breast cancer screening and other forms are going to be back issuing regular appointments to people who are screened every year or whatever. Do we know what the situation is with regard to this, please?
Okay.
Bryn.
Yeah, thank you, Eleanor. Yeah, so in terms of Poulton Hospital, so the minor injuries unit was closed there in April. I can't say for definite when it will be back to sort of pre-April levels, because there's obviously demands on shielding staff members, infection control measures make it very difficult, which is true alongside the whole health system, on returning to the level of capacity that it existed prior to COVID. So there's a reduced service currently operating there Monday to Friday, 10 a.m. to 6, and that involves telephone triaging and appointment booking to the public and telephone referral access for GP surgeries. Unfortunately, there's no walk-in facility for the X-ray service at the moment. Again, that's a measure around social distancing and infection control, which I'm sure can be appreciated when that returns to what was normal, i.e. pre-COVID. It's not going to happen in the near future, I would say, on that. But the number and activity levels at the MIU are being closely monitored by the CCG. So that was the first part, Eleanor. So your second question was around cancer, and we had a question in on that. So could you just repeat that, Ellen? Was it around the screening?
Well, there are two aspects to, well, more than two. First of all, the question of the routine screening and when and if that was going to resume. I'm thinking particularly, of course, about breast cancer, having had it twice myself. I've got a bit of a vested interest in this one. And secondly, I've had conversations with senior health professionals at the RUH, and they're very concerned about the lack of referrals from GPs, and very few people coming through now who previously would have reported to A&E with symptoms, suspected cancer, referred through, particularly, of course, bowel cancer is something that's often picked up in A&E, or rather the process begins in A&E. And I was wondering what levels we're looking like now and when they might get back. Whether GPs are now referring people, say, with suspected breast cancer or what or not.
Okay, so I'll take the second part there, start with, if you don't mind. So the 2-week wait pathway for suspected cancer was never changed from primary to secondary care. That was always acceptable throughout the crisis. But of course, numbers were down on that, as you say, and that's mainly due to the lack of presentation from the public concern into primary care. So the things that we do about that, so one, there's a very open message in public comms that primary care and indeed access to secondary care around cancer is open for business as normal, with acknowledgement of social distancing measures. Secondly, any GP would always, once doing triage, if any risk or cancer is suspected, will always bring them for assessment where necessary, or if it's not necessary, refer them as part of that pathway. So in terms of that, there's been nothing change in that respect. Also, as a priority in primary care specifically, are what we call the quality improvement projects. There's a couple of these this year, and one is around cancer. And the responsibility of practices and indeed primary care networks is to improve practice policies in early identification of cancer and uptake of screening. So this is a key priority for the practice. That's been sort of reset very early on, so it's already the priority in primary care coming out in the restart process. In terms of screening turning back on, so I would like to sort of go away and just confirm on the breast screening. I'm aware bowel screening, the FOB testing is currently up and running. I'm not 100% on the mammography element, so I could take that away for a written response.
Thank you very much.
So, Jess.
Thank you. I wanted to ask about the winter again, and in particular the flu vaccine, and what plans are in place to increase the uptake of the flu vaccine, and also whether or not there needs to be a different way of delivering it, you know, with less people going to GP surgeries at the moment.
Yeah, thank you, Councillor. There absolutely has to be a different way of delivering it, that's for sure. We've previously relied on ad hoc presentations, so when patients are presenting for something else, and then flu clinics that wouldn't pass any sort of current social distancing requirements in the slightest. So in Baines, we're proactive on this in working alongside our PCNs and the CCG primary care team in getting plans in place for how to mitigate that risk around social distancing, and that's a little bit practice dependent. So some practices are able to put in effective social distancing measures, move their time of when they're doing it, for example, doing it on a Saturday morning when there's no other football practice, having longer appointments, more infection control measures. Some practices may not be able to do that due to the nature of their building, for example. And so we're looking into alternative options there, perhaps alternative sites where necessary. Obviously, there's some IT issues around that and governance issues, but that's what we're in discussion around. So absolutely, it's a high priority. We've already been in discussion for weeks, so very early on prior to this sort of traditional flu campaign season. And that's with recognition, Councillor, that it's more important than ever, isn't it, to get the flu campaign right and not be adding to the additional risk of managing suspected coronavirus.
Thank you. Kevin.
Thank you, Chair. Three things, if I may, Bryn. The first is, how much latitude or freedom do the local directors of health, public health, have in the system now to manage the pandemic? Are they very much in control in the area, and do they sort of direct operations? The second question is around PPE, and again, are we autonomous in what you do in terms of getting your stocks ready and building up if anything is depleted? And lastly, the Nightingale Hospital, are there any plans for other uses while it's just lying there at the moment? And would it be the first port of call if, like a hot site, should a second wave come about?
Thank you, Kevin. So the first question was around the autonomy of the DPH. So locally, we've set up a committee, the COVID-19 Health Protection Committee. It's Bruce chairs, and that meets weekly, and that manages the operational side of COVID. I believe there's a subcommittee of that is the LOMP, which was alluded to earlier. And that's all about identifying and preventing further outbreaks. So within that respect, there is some local nuance, if you like, and autonomy, because we have to respond to the specific situations of Baines, the high-risk areas, schools, health sites, any areas that there's a high density of people out of necessity. So they're what are being looked at and how we respond in terms of testing, tracing, infection control measures in response if there is an outbreak in those areas. So I think there is a lot of autonomy. We are working in. I don't sit on that committee, but I'm aware they still have to work within national measures around that, which can sometimes sort of limit what you do. The second question around PPE. Yeah, as I may mention in the report, there's an incident centre set up locally, and part of the assistance to that is monitoring, assessing stock levels, and responding quickly if there is a shortage in certain areas. And I think we've partly due to the levels we've had of COVID in this area, been quite fortunate that it hasn't reached crisis point, particularly within the health system or the care system either. And I think that's additionally due to the monitoring of that service and an understanding with the IUH that they can respond quickly if there is a shortage outside of the hospital environment. Not to mention the sort of valued support of third sector organisations that have helped source and provide some of that was alluded to, I think, in the previous reports. Your third question, may be able to help on Leicester, Kevin. So that was about other uses of the Nightingale Hospital. So there has been parties to some discussions where it's been alternative uses have been considered, but I think they've sort of been looked at and disregarded in terms of the support needed to maintain them. Would not be a valuable use of resources if it's not dealing with the outbreak of the crisis. I can't give you any more detail on if there's any other working options, to be honest there, Kevin. I can again take that away and address that unless anyone else has any thoughts.
Thank you, Bryn. I'm going to bring in Becky Reynolds because Becky, you say you can make a contribution to the question asked.
Hello, thank you, Councillor. Yes, it was just to build on what Dr. Bryn Bird was just saying around the autonomy of the local director of public health, if that's helpful. So as Bryn said, we have a COVID Health Protection Board that Bruce chairs, and that has overarching responsibility and overall responsibility for implementation of the local outbreak management plan. We've also got a COVID engagement group, COVID engagement board, that's chaired by the leader of the council, Councillor Dino Romero. So the overall implementation of the local outbreak management plan happens through the Health Protection Board, and that's been meeting weekly, and it has a number of subgroups that are slowly being built up. Some of them will be ongoing, some of them will be tasked and finished. One of them is around testing. So I think one of the things that's happened nationally over the last couple of months really is a move from national control over the prevention and management of outbreaks to increasing expectation that local authorities will take responsibility of this. And so just a month or so ago, all local authorities were given an allocation of national funding through which they were expected to develop and implement local outbreak management plans according to the needs of their populations. So the Baines Council received about 850,000 for that as part of our allocation. So there was an increasing expectation that local authorities, through the Director of Public Health, will develop localised response plans, and that's particularly seen in the case of testing and of contact tracing. So specifically for testing, there's a whole national testing infrastructure set up, whereby, and that's all set up nationally, and you'll be very aware of it, I'm sure, whereby you might drive to a regional testing unit if you're not feeling so well and you've got symptoms of COVID. So our nearest one is Bristol Airport, or else you can order a home testing kit online or phone up if you don't have access to the internet. That's all part of the national testing structure. That won't suit all of our communities. Some of our vulnerable populations won't be able to drive, won't be able to self-swab, to swab their own throats. And so we need very much, and the expectation is that we will develop some localised responses in recognition of the needs of our local communities. And that will vary from local authority to local authority, as we've seen recently through Leicester and Leicestershire, a very different population that we have here. So sort of in brief summary, yes, there is much greater expectation that local authorities have greater autonomy, still working within a national infrastructure and working with our LRF and other partners, but a much greater expectation for local flexibility, especially around testing. But is that okay? Does that help, Vic?
Yes, thank you. That's a useful update. Yes, thank you. Now I've got Paul and Rob, you've just signalled, but I'm going to need to bring this to a close shortly. So Paul,
you've also got Mark before Paul, Mark Roper.
It's all right. It's okay. My question's been answered by people.
All right. Thank you, Mark. Thank you. That's helpful. So if I go to Paul then.
I'll be fairly quick, Chair. Thank you. Dr. Orpen was a really good representative of the CCG and welcome Bryn to democracy. And just a couple of policy questions. The issue lots for the community of Bath and North East Somerset actually relate to and look more towards the BNSSG area. Can you just give any information about joint working over the boundaries between Bath and Bristol, basically? And also, the second question I wanted to ask was that there's been a real strong commitment of working jointly with BANES, social care, and is that still going to be the case within the wider CCG area that now you've got the locality working? It's been our strength, I think, in Bath and North East Somerset. Thank you, Chair.
Thank you, Councillor. Yeah, so to start the first part, working alongside BNSSG, I wouldn't say there's any formal arrangements. So I'd say we're probably prioritising merging the three organisations to start with. I'm certainly aware of several informal arrangements. So our overall clinical chair, Dr. Gerda, I know sort of touches base and learns from his counterpart in BNSSG, Dr. Hayes. I myself actually work across both borders, and that's quite conducive to learning from both organisations, to be honest. So I'm the locality chair here, but get to learn and meet and network and understand what's going on across the border in South Gloss, and therefore a lot of BNSSG. So there's several informal channels, and I'm sure that's something that can be built on from the ground up. To answer the second part of your question, I mean, absolutely. So integration, when we talk about integration, means quite a few things, doesn't it? So it can be primary, community, secondary care, it can be mental and physical health. And in this case, it can certainly be integration of health and social care. And they're three of the areas that talked about in the long-term plan as heading towards greater integration, not less. So I think in taking up your question and alluding to my report, I feel the aim would be to uplift for perhaps Wiltshire and Swindon to learn a little from us, I would say, and how our integration has been the past few years. I've only been involved in BANES for like learned a lot in this time, and I think that learning needs to be shared across the three sites. So it's definitely a working towards us and even beyond in terms of integration rather than the other way around.
You won't be aware, Bryn, but Paul has had an air of mischief about him in asking you that question, because he knows full well, and he's been reassured previously, that there will be porous borders with BNSSG, and from the outset. So a little bit provocative there, Paul. And Bryn, what I failed to do was to welcome you to this scrutiny panel, because this is your first of many, I hope. And you've had some quite robust questions, and you've asked with significant qualification. So thank you very much. So I'm going to move now on to item 9, Children's Service Improvement Plan. Aware that if we were working to a 2-hour agenda, we are 3/4 of the way through it, and we haven't actually gone to the main agenda yet. So I'll ask people if they can be quite succinct in what they ask and the answers given as well. So can I invite Mary Kearney-Knowles to present the report, please? Mary.
Thank you, Vic. Thank you, Chair. Thank you, panel. So what I have presented to you today is an overview of the local authority requirements to be prepared for our inspection by our regulators. And what I have set out is a report that gives an overview since we had our last full offset inspection, which was back in 2017. And at that time, we received an overall graded judgment of good with some areas for improvement. And since that time, we've been working to both develop, retain and improve standards across the service. So what the paper aims to do is to give an overview of that improvement journey that we've continued to be on since 2017 and give some assurance to the panel of the commitment of all colleagues towards increased and continued improvement in terms of the services that our children and families can and should expect. So in terms of on page 2, in terms of the introduction, what we detail out in section 3.2 was the set of recommendations that had been made back in 2017. And also in section 3.3, we had what was called a targeted visit back in November 2019, where they specifically looked at how we had progressed in terms of our services for children in care and care leavers, and with some additional areas for improvement. So if I may, if I highlight some key points under section 3.4, which highlights some of the key areas that we've been focusing on that improvement journey. And then I will give some of the key priorities for 2020-2021. So quite a bit of what we have done is around improving our quality assurance framework. We've done a significant amount of work in terms of the quality of data and our overview of performance and how well our social care staff, be that frontline as well as head of service, how they understand the data around the performance and what we're doing to analyse that. We have further enhanced our audit arrangements whereby we audit our practice against a set of standards and have introduced a moderating process to further provide assurance around that practice. And you'll see in that paragraph, we've widened that out across the entire service in terms of who has responsibility for undertaking audits. In fact, I personally do bi-monthly audits myself, so I've got frontline of side of practice. We did a tremendous review of our front door in terms of the entry into children's social care post that inspection in 2017. And I'm really pleased to say that following quite a significant amount of consultation and redesign, we have moved to implementing the redesign of our front door and safeguarding outcome service as of the 29th of June. And I guess in this paper, what I also want to give assurance is that while we may have COVID-19, we've continued with our improvement journey in all areas. The next key item I'd like to highlight is the work that's been done around our children in care and care outcomes, where we've also looked to redesign and enhance the quality of offer to children in care, as well as our care leaver offer. One of the areas that we had significant challenges back in 2017 was around our provision for private fostering arrangements across Bath and North East Somerset, and there's been a significant amount of work done in that area, both in terms of guidance, training, support, and more recently we had up to 30 private fostering arrangements back in 2019. So a big area of support. The next section again looked at the focus visit for care leavers in 2019, which confirmed it wasn't an assessed judgment. We got a letter at that point, but it certainly validated that we've made significant progress in those areas that were identified back as needing improvement back in 2017. The next section, still continuing under section 3.4, with our colleagues in quality assurance, which sits under Chris's area. There's been significant developments in our offline quality assurance, where child protection chairs and independent reviewing officers actually quality assure after every child protection conference or looked after child review, which is really, really positive. I've mentioned earlier on the call about the work of the virtual school through the COVID period, but the work of this virtual school since 2017 around the support to children in care and care leavers has been exemplary. I would just like to highlight our practice around recruiting social work students, our assessed year in practice, and how positive we have been about retaining those social workers who are newly qualified across the service. And the final bit I would say is the support that we receive from our commissioning colleagues in driving improvements in terms of all of those commission services, which of course support all of our most vulnerable children and sit within our wider service improvement. If I may, I'll go on to section 3.5, which then identifies the key priorities that we're currently working on through 2021. One, of course, is the actual implementation of the redesign of our front door. And I'm really, really pleased that we moved into our hub and spoke model from the 29th of June, so that those teams all have a presence here in the Civic Centre, with the remainder of the teams working from home, so that we've got the least amount of staff in the office, but we've got sufficient in order to implement the new model, which is really, really positive. We will be working with our business intelligence service to evaluate the impact of that redesign, or in terms of the safeguarding outcomes. We are also introducing a practice model. Back in 2017, one of the areas that we were quite criticised was that we didn't have an articulated unifying practice framework. We have now agreed that that will be a systemic way of working. And we're really pleased that the Centre for Systemic Social Work in London will be delivering our training programme locally in Bath and Bristol from September, partly funded by the DFE. Performance information continues to be an area for us. We strive to continually improve our performance, and that will remain an area of high focus. Our quality assurance mechanisms, we continue to review those arrangements and what more we need to do about embedding quality assurance in everyday practice as opposed to auditing after the fact. And a key focus remains on our care leavers, particularly care leavers in this period in terms of the COVID-19 period. I know I've spoken very quickly through that report, but I'm hoping that the detail within the report gives an assurance that as a service, we are absolutely committed to moving to be outstanding. And in those areas where we required improvement back in 2017, we've made sustained progress. Over this period, Ofsted have suspended their inspection framework, but we have had regular phone calls with Ofsted through the period to give them assurance around our activities and also how we've been delivering our revised delivery plan. And new guidance came out from Ofsted just on the 6th of July, where they've confirmed that they will reinstate the inspection of local authority children's services from late September / early October 2020. And as you would expect, we have a service improvement plan and a service improvement board that meets 6 weekly to look at both our Ofsted preparation and our progress in terms of our priority areas in the improvement plan. What sits behind this document is quite a detailed programme plan that gives an overview in terms of the detail and how we're doing on that. But I'm hoping that that level of detail gives sufficient assurance to colleagues that we are working to prioritise improving our delivery for children and families on a constant basis.
Thank you very much, Mary. Looks like we're very well ready for Ofsted. So, Michelle.
I think there were some people before me. I think we've got Paul and Andy before me.
Right, okay, you're very gallant of you. So Paul.
Thank you, Chair. In a report like this, I for those members who don't know, I was the cabinet member before Kevin, and I think the report quite rightly highlights some of the things where we're having to take action, or not having, we are taking action. But it was a shock to me when we got good rating from Ofsted, that when you went to other local authorities in the southwest, quite clearly we were, in comparison with the other authorities, doing exceptionally well. There was only one other good in the southwest. And I think the work that Mary's put in, and including Mike Bowden in terms of the overall sector improvement, which I think has been excellent, has drawn in DFE money. I think this report is so sound, and I really do compliment Mary on the quality of sticking with this for a long period of time to actually try and get us to outstanding. And that's really the challenge for Kevin and Mary and all the team, is how do we get to outstanding? Because this authority is, in my opinion, nearly outstanding, and we've got to be able to prove that to Ofsted when they come in. So I'm sorry, it's not a question, it's a bit of a speech, but I think it is important that we actually recognise that in a report like this, you don't highlight the good points as much as you perhaps could. Thank you, Chair.
Good point out there, Paul. I concur with what you say. So, Andy.
Hello, Maria. Thank you for a thoroughly good report, and thank you, Paul, for filling in a few details that I was not aware of, like the goods and the how that stands across the region. So thank you for that. I was in education all my life, and I know how difficult the NEET students are, those who are not in education, employment and training. And you make a point at the top of page 29 that you still have challenges in this area. If we are to progress to outstanding, I suspect this is one of the areas we're going to have to look at. The thing I found difficult about this particular paragraph was that there's no statistics linked to it. So you say that you have challenges with NEETs, but I have no idea what percentage or actual raw numbers there are, which are your concerns. So that's my question, but I don't want to waste time. So I want to add just another thing. At the bottom of page 29, you also talk about Appendix A, which is a load of statistics, Annex A rather, which is a load of statistics. Now, I'm a bit of a statistician, so if you could send that, it's not, I don't believe it's in the documentation, so if you could send that to me, I would be very interested to read that. Thank you.
Right, thank you. Michelle.
Andy's largely asked my question, but I was going to ask about those who are NEET. How well engaged are they with the support we're offering them?
Yeah, I think we within Bath and North East Somerset, we work very closely with what's called a social impact bond. So we're working with colleagues in Bristol and a company who work really, really hard about engaging with our young people. And from a performance point of view, our young people do much better than other parts of the country. But of course, the reason I put that comment in this report is because of the potential impact in terms of COVID-19 and the loss of training. So it is an area we will have to continue to focus on in terms of supporting those young people. But we have plans in place. We have an employment officer, and so we've got access to the resources. But I did want to highlight that it's a particular risk for that cohort of young people in this period. Thank you.
Okay.
I'm happy to provide the Annex A to colleagues. Apologies.
Yes, thank you, Mary.
Yeah.
Thank you. So, Eleanor, you have some questions on the behalf of Liz Hardman, I understand. Eleanor?
Yeah, I'm just trying to
unmute myself. Right.
Right.
Number one, she wants to know, can we get assurance from social workers have a manageable caseload
and an effective management supervision? Did you get that?
Yes, I did.
An effective management supervision.
Provisions.
Secondly, she wants to know how we provide improving child protection plans, and does the unifying framework avoid drift and delay?
Okay. Thank you, and thank you to Liz for those questions. If I take them in order, so in terms of how we assure that social workers have a manageable caseload and effective management supervision. So as part of the redesign, what we were looking to do was to reduce the caseload somewhat. And that is the aspiration, so that social workers would have smaller number of cases and would be able to work with the families longer. But in terms of answering the question around how we get assurance in terms of the caseloads and supervision, so we have a standard established arrangements of regular one-to-ones, team and management meetings. We have a monthly performance meeting with managers where we specifically look at the caseloads, and we have an overview of the quality of supervision. With the new practice model, that brings in what's called reflective case discussion. So that's a new additional level of opportunity around reflection and supervision. And then in terms of how we scrutinize that activity is through our regular bi-monthly audits and through the service improvement plan. I think it is fair to say that currently, as we're moving into the new model and moving away from the old, some caseloads are a little higher than what we would like. And we're obviously recruiting to some vacancies currently, but it will impact on having reduced caseloads. In terms of question 2 about how we're improving child protection plans, so we've been doing quite a lot of work with social workers about co-producing their child protection plans with families. I think it's fair to say that over the last 12 to 18 months, we've been trying to work more collaboratively with our children and our families, perhaps more than in the past. And what we're also trying to do is use family group conferencing more. And that's an arrangement where we meet, where the family identify who the key family members, either within their family or their extended family and friends network, who would be able to help support deliver that plan. So those are the 2 key things from a children's social care that we're doing around child protection plans. But I do know my colleagues in independent quality assurance have also been looking at the child protection conference process itself, and have reintroduced some refreshments to make it easier for families to take part in the conferences. In terms of the third question around the unifying framework about drift and delay, that's a really, really good question. And it's certainly one that we've really considered around the model. So our aspiration is that the practice model will enhance social work satisfaction, which would impact on retention and contribute to less drift and delay. But also, as we're moving to having a static triage with longer term hubs, social workers will be working with the families for the period that they need that input. So we'll start stopping what used to be the start again syndrome. So we do believe the unifying framework will support us to deliver a much better service and have more trusting relationships with families, and therefore again avoiding drift and delay. Does that give sufficient information? I'm happy to give more.
I would think so. Thank you.
Yes.
Thank you.
I'm rather inclined to think it would do.
Thank you,
Mary, it's a good and encouraging report. So I'm going to ask the panel to take the recommendations as presented on the report. Would that meet with the will of the panel members?
Yes, but Chair, I think that Kevin Burnett had something he wanted to say.
Kevin, did you have something?
Only a very quick one, Chair, and just to thank Mary, obviously very detailed and an awful lot of hard work going into this. Just purely from a point of view of looking at all the huge progress you're making, if just for the summary we could have a sheet with just the target that you spoke and what your the outcomes are and how it's improved. 2017, 2019, 90% was 60%. Just be so good to see all the progress you're making. Bless you. Thanks. And I think there's one typo under 1.2, which I think it might have said assessed instead of accessed. I don't know.
Oh, thank
Bless
you.
you.
Thank you very much. Thank you, Kevin.
So what the panel will be looking for, Mary, is a more concise summary rather than wade through so much that you could actually scrutinise with a little bit more succinct evaluation. So,
Chair, can I just come in there, because I think from Ofsted's point of view, they look at all the records, and I think it is important that we actually did have that level of detail, because these are the most vulnerable people in our community. So I wouldn't want to simplify it down too much on an important item like this, if you don't mind me saying.
no, it's a good point, but also Kevin's point that something that's by way of a summary to try and be more concise might be helpful as well. Combination of all. Let's have that compromise. So as I said previously, would the panel accept the recommendations as presented, 2.1 to 2.3?
Chair, just before you do that, could I just offer my thanks to Mary and the team? And you've all said it. I think that because how comprehensive the report was, it just shows how hard they've been working, particularly in these really circumstances. But I would agree that a more digestible summary for this panel would be a good way to move forward. But obviously, with regards to Ofsted, they would regard Mary's report there as a brief summary. That's the way Ofsted works.
Yeah.
Thank you, Kevin.
We're always very apprehensive about Ofsted coming to us, and quite rightly so. But in this particular instance, we welcome them, I think, because I think we've got something so positive to offer to them. Bring them on. But there you go. So for the third time of asking, will you accept the recommendations as accepted in the report? Let's have a thumbs up. It looks like everybody good, excellent. So we can move on, and we move on.
Well done, Mary.
Thank you.
Yes, thank you, Mary. Thank you.
Thank you.
Move on to item 10, the Bath North East Somerset Council School Organisation Plan 2019 through to 2025. And if I can jointly invite Helen Hoyles and Chris Wilford to present the report. So over to the pair of you, please.
Hi, thank you. Thank you, Chair. My colleague Helen is going to be available to, who authored the report, and also the school organisational plan is going to provide some more detail. But the school organisational plan is being presented here today to provide reassurance to Scrutiny that we are planning for the numbers of school places that we need for our children in Bath and North East Somerset. It's over a core period of 2019 to 2025. The school's organisational plan covers the capacity we need for mainstream school places, but I also just want to reassure the Scrutiny panel that we also have a separate process for planning for special educational needs places, which is led by our public health team. There's a different, the formula for how we predict our future need for mainstream school places is quite set. The formula for how you predict the number of SEM places is much more complex and not as well defined, so our public health team will lead on that. But it's just to reassure the panel that we have a significant planning for children with SEND in the local area. And for you to have an opportunity to give any feedback and have questions on content of the plan, I will hand over to my colleague Helen, if that's okay.
Okay.
Hi, yes, so thanks Chris, and thank you, Chair, and hello to the panel. So just a brief update of sort of summary of what the plan is. It's an update of the plan. It's done every 2 years. The key points at the moment are that we're entering, thankfully, a period with primary school provision of sort of stability, with sufficient capacity available. We're just reaching the end of, or some of our last schemes, if you like, that were planned to go in to provide the primary capacity that we project we need. There's a scheme in Peasdown St John and in Cameley for expansion to those two schools, and there's a new school going into Cambridge and Two Rivers, and a new school in Norton Hill Primary in Midsummer Norton is also opening this September 2020. So we've got primary is well under control. With the secondary, we're now moving, so those primary school pupils that are now moving into secondary. We've been working sort of productively and effectively with multi-academy trusts to put in a number of schemes at several schools, mainly in Bath, and one at Norton Hill Secondary School. So we've got expansion schemes, as the plan says, at Hayesfield in Bath, at Oldfield in Bath, some capacity to St Mark's and to Ralph Allen, and those together are projected to provide us with sufficient capacity going forward up to the end of the plan period, this current plan period of 2025. The only other real thing to mention is that there is some sort of recent movement with the future house building in the local authority. And my understanding is, talking to colleagues in planning policy, that there's a new mayoral spatial strategy going to be prepared going into 2021, which will identify the new long-term housing requirement for Bath and North East Somerset. There'll be a new local plan, and of course all that is they consult on. And what will happen is that planning policy will consult closely with us to make sure that any housing that's proposed is aligned with sufficient primary school infrastructure to meet the projected need. So that, in essence, is a brief summary of the plan, and I'm happy to take any comments that the panel have.
Thank you, Helen. There is projected, there's considerable growth, and I'm relating to what I know more familiar with, is Chew Valley School. It's virtually another 500 pupils is predicted. That's enormous amount of children, and ferrying them to school. I've worked it out. There's about 300 coach loads a day, twice a day, to take them and bring them and take them. So there's a huge organisation behind this, isn't there?
Yeah, a significant proportion of those children going into Chew Valley. Obviously, Chew Valley Secondary School, by definition, serves a large rural area. It has to, so it will pick up from all the villages and in that area of the Bath North East Somerset. But also, there's quite a few children choose to come into Chew Valley from outside of Bath and North East Somerset. So there's a significant number of those children will be there because they're choosing to come in from neighbouring authorities.
And you say that you're working closely with planning on the spatial plan, but we've got this proposal in Mendip for a considerable development on the edge of Midsummer Norton, technically in Mendip, and there's an inquiry going on, as I understand, to try and resolve those issues. But again, in a great
well, can I say a few things about that, Vic? Because I'm actually in the local development forum group who are working on this, and I'm going to go to the inspector's inquiry into this Mendip housing.
Right. Well, I did provoke that question, so you're jumping the gun, but go ahead, Eleanor, please.
Well, thank you very much for this report. It's really very comprehensive, and it sort of rings bells because I was involved in the 2007-2008 report. I'm very interested in the whole thing, but I've been looking at it from the point of view of a long-standing member of the planning committee, and also, as I've just referred, to the planning policy committee, and this is where there's a bit of a mismatch, I'm afraid I have to say. The final pages of the report on where we have got to with the joint spatial plan and all the difficulties around that. The new local plan and so on is very good. The impact of the MENDIP local plan, it goes through and it's back with the inspector in September, will be very considerable, because if it's all accepted, we will end up with 515 dwellings on the borders of Westfield and Midsummer Norton, and about 180 of these dwellings will be nearest in walking terms to Westfield Primary School, which has a very high reputation. Of course, you never know in any work like this how many parents are going to opt for a religious denomination school. St. Benedict's is actually literally on the edge of the new developments, but we don't know if people want to take up MENDIP places. Now, the important point about all this is, apart from the actual capacity and whether the new school in Midsummer Norton with 630 places will be sufficient, is that although the per capita money for educating each pupil follows the pupil into whichever authority they're being educated in, the SIL money and the Section 106 money, which is referred to several times in this report, does not follow them. So we can be in a situation where we need to put an extension, say, on Westfield Primary School, although that'd be difficult, it's quite a tight site, but we wouldn't have any money for it from the developer or from the authority. Similarly, conversely, of course, we've got all these kids going to Kilmerston School, but if Kilmerston wanted to expand, they wouldn't have any resources from Baines to do so, because actually Kilmerston School might be accessible for one of these new developments at least. So it's a very fraught situation, I think, and we meaning the planning policy team, Richard Denoy and his friends, and Westfield Parish Council, that's me delegated by the council with arguments, are going to argue that it's unreasonable to build these developments because of the impact it will have on the schools, the medical practices, the A367, and we fear that there just simply are not the jobs in the area. So I expect this will actually be an overspill for Bristol, we will find, of people commuting back and forth, and that's no good. That's a simplification of the arguments to the inspectorate. Now, if we turn to the earlier part of the report, there's a bit of a mismatch. On page 56, the information about the Redstock area is completely out of date. First of all, the railway lands were fully developed 4 years ago, so we now have the children at St. Nicholas's Primary School or at Rislington. And the Clandown developments will not happen because the planning permissions have lapsed. That would have been another 80 houses. And that's not an area designated for housing in the existing placemaking plan. So I know it's complicated to get your mind around. There are references to building new schools where needed, but about 80% of Baines area is constricted by the Greenbelt regs. And, you know, if you suddenly need a new school in Bishop Sutton, for instance, where the planning inspector has imposed a lot of housing on us, it would be very difficult because of the Greenbelt. So I would page 68, references to the MOD site. We've just turned that one down. I mean, it's really very difficult. I appreciate for you to keep up with the planning development, but a conversation with the planners as well as with the planning policy team, they're two separate teams, might help. So, and I wondered if you could actually say a little bit more, though, in the context of all this, about how many Bristol children we're taking and what the impact is. And I don't think if a child has already started at a secondary school, they can be displaced. You know, if a Whitchurch child arrives and wants to go to Chew Valley School, you can hardly kick out a Bristol kid, can you? Sorry to make such a long speech, but it's something I feel rather passionately about.
So you've vented a lot of frustration there, Eleanor. Chris or Helen, can you offer any kind of compromised answer to appease Eleanor?
Yeah, it's quite a lot. So firstly, the displacement would relate to children who would be entering schools at the point of admission, which for secondary schools is year 7. So you're quite right. Once a child is in a school, there's no question of it being going elsewhere. So we're always planning on new intake coming in and what impact we might be able to have on that. So that's what the displacement would relate to. And there are mechanisms in place to do with some of the clauses in the planning, in the admissions policies, I should say, that allow that to happen. Whitchurch actually, the school that serves Whitchurch is actually Broadlands Academy in Keynsham, and Broadlands Academy currently has sufficient capacity in it to accommodate any pupils that may come from Whitchurch. So that's the actual catchment area for the Whitchurch area, the catchment area school. So certainly, yes, we do work very closely with planning policy. So any new housing that will be proposed would have to go along with the being able to either be enough capacity in the schools already, or one way or another we can create enough capacity, whether that's expanding a school or in those extreme circumstances where the housing development is of a large enough quantity to build a new school, and that's quite rare. We do talk regularly all the time to planning. We will get consulted on any new planning applications that will be submitted. I think if Councillor Jackson was referring to the MOD, there was a small number of extra dwellings. I think that may be the one that was recently refused. That may be resubmitted in a slightly different format. We'll have to wait and see. I don't know. So we do work very closely with both with planning as well as with planning policy. With the Radstock railway line development as a typical, what often happens is that just because a development's finished, it does take quite a while after it's completed and occupied for it to become up to full, if you like, child capacity, pupil capacity. So it can be a number of years before all of those children, but a family moves in and then a couple of years later, perhaps have a baby. So that child will be reaching school age maybe 6 years later, for instance. So that's the sort of thing we tend to see. In relation to any housing that takes place in a neighbouring authority, there is a requirement for that neighbouring authority to also consult with its neighbours, which would be us. We're not anticipating at the moment any problems with meeting needs of Bath and North East Somerset resident children. And of course, Somerset, as a local authority, would be responsible for making sure there's enough school places for any children that was generated from housing in their local authority area, in their council area. And as Councillor Jackson says, any community infrastructure levy in section 106 would go to that local authority to enable them to do that. So at the moment in that area, we're anticipating having adequate primary and secondary school places to meet our future needs.
So you have a basic construct that can be interrupted by developments as they come. So the basis is there, and then it tempers itself according to to events. If there are new applications in, then you have to accord the documents to how that presents itself. That's sort of a way of looking at it.
You mean, when you say documents, do you mean the school's organisation plan?
Yes, sorry. Yes, I do.
Yeah, I mean, obviously by definition, any plan is relevant at the point that it's published. That's why we update it every 2 years, because obviously things do change. With planning policy and the overall direction of housing development, that goes over a much longer period. And so that does quite well fit in with a longer planning that's taking place here. And my understanding is this mayoral spatial strategy, development strategy, is all very, very new news, and that's changed since this panel report itself was initially drafted.
Can I just ask a couple more things?
Yes, indeed, Eleanor.
I think you've got a terribly difficult task. Because we really don't know how things are going to boil down in the latter stages of the COVID-19 crisis. We have already, I think, picked up, have we not, that people are moving out of London, where they they think the option is to pay for expensive private education, and they've been settling in Bath because they can get an extremely good state education for free. And this has had an effect on house prices as far as I'm aware. But I suspect that because of COVID, I mean, it's suggested, let's put it that way, the national press, that people are going to leave the dense urban areas. And of course, you know, where is Baines? It's top of the list for being COVID free. So you're going to have COVID refugees as well. So my first question is, I don't know, is there any way to factor in these uncertainties in your calculations? And secondly, is this one I've mentioned already about the measures a school needs to put in place to meet the appropriate precautionary program. Is this going to mean we need more bricks and mortar so we can space the pupils out more?
Well, I could ask the first part. I don't know whether, I'm not sure about the second part. So obviously, yes, we're already aware that Bath and North East Somerset is a very popular place for families to move to. And obviously, we have seen that certainly, as you say, in the past, Bath and also particularly Cambridgeshire, having a lot of families moving in. Obviously, those families can only move if there's the housing there, generally speaking, to accommodate them. So that's all factored in, like whether those families come from London or they come for whatever reason that may be that would prompt them to come here. It's still directed, or you know, the number of houses that's been delivered, the number of units to be delivered of houses and flats will indicate and dictate how many children are living in the area. The other part about adaptations or adjustments because of COVID-19, I can't really answer, I'm afraid.
Okay, so
fair enough.
Okay, it is what it is, Eleanor.
Yep.
Are there any
more, thanks very much.
Any more comments from the panel?
I think Andy Waite had a question.
Andy?
Yeah, very quickly, you'll be pleased to know, Chair. I just wondered, with these two new schools that we have in the authority, given the COVID-19 delays, are these schools up and running? Will they be able to take pupils in September?
Yes, my colleagues who work in my team alongside me, so the capital part of the team, if you like, then yes, both of those schools are actually being delivered by the Department for Education under the free school programme. And obviously our team works closely with the government to deliver those schools. So the answer is yes, happily. Both schools are already have published admission numbers, got children coming in this September. The Norton Hill Primary, the new Norton Hill Primary in Midsummer Norton, is opening in its permanent building. And the Two Rivers Primary School in Cambridgeshire is opening in temporary accommodation, located on the site of the Wellsway School, which is in the same multi-academy trust. So they'll be accommodated in temporary accommodation, and then the new school will come forward. And there's every indication so far that thankfully, COVID hasn't had any detrimental sort of impact on the delivery date for either of those two schools.
So Helen and Chris, thank you both for presenting the report. We've got a number of recommendations again. Most of them are to note the report. Can we take them as presented? Does that meet with the agreement of the panel members? That's got a thumbs up, right? Excellent. So we'll move on to item 11, an adult social care complaints annual review. And if I could invite Sarah Watts to present the report, please. Sarah.
Yeah, thank you, Chair. This is the first time I've brought the adult social care report to panel. I usually present the children's one. I'll be coming in September with that. But the purpose of the report is really just to give you an idea of the numbers of complaints we receive, the type, the service areas, and how we use the complaints really for learning within the services. Clearly, the majority of complaints about the operational side of the service go directly to Virgin Care. But we do sometimes pick those up if the complainant's not happy with the outcome from Virgin Care, and we'll review that outcome, and ultimately the complainant can move on to the Ombudsman if they're not satisfied. So the regulations for adult social care complaints put a lot of emphasis around the learning. So I've added in some narrative about the kind of things we learn from. The complaint doesn't necessarily have to be upheld for us to learn. And areas around communication are often the type of issues that we pick up on through all complaints. I acknowledge that there are some areas to improve on. That's primarily our timescales. It's a difficult one because the complaints are often quite complex, but we are working on that, and also working with Virgin Care to align our processes as well as we can to give a good response to the complainants. So that's a very quick gabble through my report.
No,
I'm happy to
excellent.
take any questions.
That's what we want, Sarah. Thank you. Sarah, can I just bring you on page, I've got it down as page 83, but it's under point 6.7. And this is referring to the withdrawal support in the service using the direct payment. And 2 complaints concern self-funders accessing extra care schemes. The result, this resulted in a change of decision. Does that mean the decision is changed in favour of the complainant, or is it in the process itself? And then it goes on to 6.9, and again, I wonder whether it's people not understanding the process, and that rather highlights itself in point 7.5 as well. People are probably new to the process, not fully understanding it. And is this why they're actually issuing the complaint, because it doesn't meet with their expectations initially?
I think that's a very common reason for people making the complaint. They've perhaps not understood fully at the outset, and also recognising that a lot of the complaints we get are about funding. And I think what we find through the complaints procedure is very often at the point that those conversations are starting, there are other more urgent issues going on for the family, such as looking for residential care placement. So I think there's often a misunderstanding around perhaps what they will then need to pay towards the cost of that care. So that's where I think we often pick up the communication issues, even if we might review it and say the charge was absolutely correctly applied, or the financial assessment was correctly applied, but there is something about communication at the outset of that, the planning for that case, which is where the complaint comes in. I think on your first point, the issue around the access to the, I think that was the one about the extra care sheltered housing, that was the decisions there were changed in favour of the complainants, and I think that there had been a change in policy, but recognising that there needed to be a transition period while that was rolled out, because families had been told about the facility, and then by the time they came to apply, some of the eligibility had changed, and so it resulted in changing the sort of transition period, so they accepted people who'd already been told it was a possibility for them.
Okay. Sarah, can I take you to page 87?
Yeah.
And it says, to ensure Virgin Care is working to the requirements of the Complaints Quality Assurance Framework, and goes on to say the meetings between the 2 organisations have not been held regularly in the past year. These will need to be reinstated in the coming year. But there's a vagueness of that, because we're reading it part way through the year, and it's from what year and when?
So that's from April 2019 to March 2020. So we've got one coming up in July, which will look at the first quarter of this year, just gone past, so April to June this year, but we missed the March, the one for the March meeting because of the COVID issue. It was, we needed to hold the meeting at a time when people were sort of overloaded.
So it's COVID related. That's
at that point.
The continuity of it.
Yeah. So when we meet at the end of July, we will look back over the 6 months as opposed to a quarter, which is what we would normally do. and also I think we need to there's been a change of structure in Virgin Care's customer experience, so it's a good opportunity for us to look very carefully at how we're working with them.
Right, fine, thanks, Sarah. Are there any panel members that wish to make any present any questions to Sarah? No, then.
Hang on.
Oh,
oh
Councillor Jackson.
Councillor Jackson, I think, Chair.
Oh, right, okay. Eleanor, go ahead.
Yeah, well, the first thing I wanted to comment was, I thought it was very striking how the complaints, if I've understood it correctly, have been about process, and the question there is whether this can be communicated better and timescales improved, for example, for assessments. Now I've forgotten what the other question was. Dear, sorry about this one.
Well, if Sarah can answer you,
I know.
Think of the third?
It's about the whole question of communication and process. Vic, you signed off a recommendation on the home care study that we did in a previous incarnation as cabinet member for health, that we should make more efforts to communicate with people for whom English is not their mother tongue. We looked, for example, about getting leaflets in Bengali, but of course we've got large Polish community. So I was wondering if any possibilities had opened. We also, in our study, uncovered the problem of communication that residents, dare I say, because of their prejudices, were having a difficulty communicating with they named African carers, which wasn't fair at all, I felt, or we felt, but I was wondering if this underlying problem was still there. And if I've correctly understood, you have not had any complaints about the actual physical visits and care that we had when we did that study. And in that case, well done, congratulations.
Can you qualify that, Sarah, please?
Well, I think that this report does dwell mostly on process, because we are dealing, Virgin Care will pick up those issues around the direct provision of operational services first, although I would say that we do oversee those complaints, and we're not getting complaints about visits or difficulty with communication with carers or anything. So although we're not dealing directly with them, we're not seeing that come through when we look at what Virgin Care is dealing with. So I think that probably is a positive. I mean, in terms of process for us, we're dealing very largely with the financial assessment, and there's the new charging framework in place as of April, which hopefully will is a lot bring in a lot more consistency. I think Virgin Care staff talking to families about charging for services will have a far better consistent base on which to start those conversations, and so I think over this coming year we will see some of those complaints drop off, because there will be better information going out right at the outset. I would say we have seen a rise this quarter in complaints about the charging, but that's because it's swapped over. I think they'll tail off once people have received their new financial assessment for the year, and we'll get a lot more clarity around process. So we're definitely seeing the charging framework as positive in terms of complaints.
Thanks very much.
Okay.
Yes, thank you, Sarah. And it is mostly sort of the financial interpretation through the process that are identifying themselves here. And it's not about service delivery, which is has to be commended, because those are the type that we really don't want.
No, yeah,
so,
absolutely.
So are there any more contributions from panel members? I'm conscious sometimes I miss people. Ruth.
Yeah, thank you for the report. I just have a question about something on page 87, 10.2, about other work undertaken. System for responding to MP and council inquiries is now in place, so that sounds like a positive. Would it be possible to sort of make that more widely known to all of the councillors? What they need to do if somebody comes to them with a complaint?
Yeah, sure, we can do something on that, because I think that was why we've worked to get this in place, because I think there's been those kind of issues have been arriving at different places throughout the organisation, and so we can now pull those together. So yes, we'll get something sorted on that, so that there's a lot of clarity around the process. And yeah, and we're always, my team's always a contact point for those. That's fine.
Thank you very much.
Okay.
Nothing further from panel members then. I have to thank Sarah. Thank you very much for a very encouraging report.
Okay.
And we're as a panel, we're noting it.
Okay. Thank you. Thanks.
Thank you. And so we move you now to item 12, which is food poverty. And if I can invite Kathy Mahoan and Becky Reynolds to present the report jointly. Kathy and Becky, please.
Thank you. Just to say, Kathy's leading on this. She's the expert, so she's speaking to this. I'm here if needed, but Kathy is speaking to the paper. Thank you, Kathy.
Okay, then, right. Thank you. So, Kathy.
Thank you, Vic. Thank you, Becky. Hello to the panel members. So the report today is our 6-month report based on our food poverty action plan progress. So the last time we came to the panel was in January. And at that point, we were saying what we wanted to do. And now this report is really about our progress since that point. So you will see that we said we wanted to set up a steering group to help us form a food poverty action plan for Baines. And we did that at the end of March, which was just at the start of the government lockdown period in response to COVID-19. So as you can imagine, our steering group meetings have been very much focused on helping to coordinate and improve communication and activity around food supply and food distribution in the area. And so this report starts by, I suppose, trying to give a sense of the activity in relation to increased demand for welfare support, increased demand for food aid, and other forms of support during the lockdown period, which is continuing. And then, and in particular, what we noticed is that those people that we had already identified as in food poverty in Baines prior to COVID, their situation has essentially worsened. And then on top of that, we have now seen a huge number of people who have also become vulnerable due to income issues around debt, around needing to claim benefits, around unemployment or being made redundant. And we know those issues will continue into the future because whilst there's been some useful government support to help people in terms of furlough and a ban on evictions, for example, we know that that support will taper off and come to an end. And so there is much concern in the coming months and years ahead that the impact of COVID-19 will have in terms of income inequality as people build up debt and rent arrears and potentially struggle to find jobs in the coming months and years. So the report does give an indication of the type of food aid and the quantity of food aid that we're aware of via the steering group, but just also acknowledge that there's obviously been a lot more going on in local communities that we're not aware of, either formally or informally, through parish and town councils and other voluntary organisations that we haven't been able to capture here, but that we are working to try and get a better picture of the complete need that identified itself on top of the existing food poverty need that we had already identified prior to COVID. And equally, the progress we've made as a steering group has predominantly been to look at our terms of reference, which I've included as an appendix, so you can see what our overarching aims are there, and the membership. Although the membership continues to grow at every meeting as we find out more and more about who's interested in this agenda and who would like to be involved in helping to address it. We also put together a framework for our planning and action around this work, and have looked at particular themes in terms of how to actually maximise the amount of money people have in their pockets, as well as issues around both emergency food aid but more sustainable provision of food locally, which is both affordable and healthy. And as a result of that, we've put those discussions that the steering group have been having into an action plan around various themes: income maximisation, food for all. We want to more effectively involve people who are experiencing food insecurity in designing some of the solutions, as well as being part of the decision-making process. And we also know that we need to improve our data in terms of understanding need, and perhaps look at a communications plan as well, and how we might more effectively communicate what support is out there already. We'll have a whole new cohort of people claiming benefits who won't necessarily be used to engaging with welfare support services and won't know what's available to them in terms of citizens advice, employment support, for example. So there is a lot of work to be done there. So I just wanted to highlight as well that we have recently launched a holiday food grant programme with St John's and with Feeding Britain, who both put in £15,000 to create that fund to enable some food provision, but also activity provision during the summer holidays for children and families. Obviously, it was welcome that the government has now decided to fund free school meal provision during the summer holidays, which is great. However, we do know that there will still be a need for further support for people, and that won't cover necessarily their costs. And also, we want people to still continue to engage with agencies in the community and with community groups. So that fund was for £30,000, and the panel met recently to allocate that funding, and it was overwhelmed with applications, and there was a lot more applications than we could fund. So it's another indication of people wanting to engage with this agenda and provide support in their community. So the proposal, I suppose, around this paper is to ask for some feedback on the draft action plan. I will say the actions in there are draft, and the process is that the task groups which are currently forming will take away those specific actions, form them up in more detail, and then prioritise them. And what's been great about this steering group is the way in which people have been volunteering to help in terms of chair groups and take the initiative on key pieces of work. So I think I'll stop there and open up for questions.
Thanks, Kathy. When we were first considering this, it was quite an ambitious proposal, really, because you wondered, we haven't been engaged in a process like this before, and fulfilling our obligations. It was superbly well timed just before COVID, because of course the problems have exacerbated themselves now, and they are going forward going to be that much more onerous. So, but it's magnificent that we got it up and running and established now, so that we can deal with it, because problems, as you rightly identified, Kathy, are going to get more considerable. Eleanor, you want to ask a question or make a contribution?
If I may, you've unmuted me. Yeah?
Yeah, we can hear you.
Good.
You're a little bit muted, but we can hear you. No, we can't.
Well, I stopped speaking, checked that I was unmuted.
Yeah.
Right.
Right.
I
got two here from Liz Hardman. She wants to compliment the group on the work that they've done, but she wants to know, how are you going to complete the remainder of the action plan? Are you going to, or how are you going to review the cap on welfare support provision and the criteria to meet the increasing demand? And she wants to know if we've got the resources to meet this demand, which you have already mentioned. And secondly, she wants to know, how will you get people involved in the steering group who have experienced food poverty themselves?
Okay, thank you.
Kathy?
So in terms of how we're going to move the action plan forward, as a steering group, we've been meeting every 6 to 8 weeks at the moment, and we will move that more to a quarterly basis going forward, because actually most of the work will be done in task groups that will form around specific themes, and essentially that's how we will move the work forward, and then it'll report back to the steering group, and the action plan will report to the steering group at each meeting, and so the steering group can ask about progress and get reports on progress in that way, and ensure we continue to move forward. So that's the sort of process for the action plan. In terms of the reviewing the cap on welfare support, that again has come from our own welfare support team, who are working with us on the steering group, and are key members of the income task group. So they particularly want to look at that, because there's a cap around how many times you can ask for support through welfare support and food banks, for example, on an annual basis, and it's usually around 3. I mean, there is flexibility about it, but they want to look at it in terms of, is that appropriate, and can it meet increasing demand? In relation to have we got the resources to meet increasing demand? Short term, yes, I think is the answer, because the government announced £63 million of grant to local authority, particularly around welfare support during COVID, and they announced that in June, and we've had our allocation of that now clarified, and it's 143,000. It is a one-off grant, and it does need to be spent in this financial year. So I think in short term we can say yes. Longer term, I don't know. That's something that we would hope to look at in the income task group and bring up and feedback to, escalate in terms of whether more resources needed going forward. In terms of involving people with lived experience, it is one of the more sort of resource intensive elements of the plan, but it's so important, and there's lots of good practice that we can build on from either the Feeding Britain network and also Sustain, which we're part of now, where they've demonstrated how they have actually involved people really well, and I think our approach is going to be initially via the organisations that are supporting us on the steering group, who have good relations with their service users in the first instance. So people who've come forward are Curo, the children's centres, and some of the charities are saying they would like to help with that. So that will be our starting point, with people that we're already engaged with, and look at how we then start to build on that and build on people's skills and confidence, and how we can resource them to be more involved at say meetings or decision making around certain projects that are going forward, depending on their interest.
Thank you.
Kevin.
Thank you, Chair. Kathy, a couple of things really. Looking at your steering group, I just wondered if you had considered or already have people from different religious groups. I know that being on SACRA, there are obviously some minority groups that may use that way as getting information and things. Secondly, possibly again getting the message out, whether you considered social media and Facebook and things like that. And thirdly, do you have a sort of simple flow chart about how people can contact you or access different things?
Thank you, Kevin. So in terms of the membership of the steering group, I certainly would welcome any other contacts that would help us to look at representation across religious groups. At the moment, we have representation around the Christian Action Network via Peter Hayward on the group, but we haven't broadened it out to any other religious groups, but we'll welcome that. So if you're able to share any contacts, that would be brilliant. In terms of social media and comms, I think we need to use all the avenues available to us. We need to put together a communications plan. That's one of our next steps on the action plan, is to look at what it is we particularly want to communicate, who to, and what methods. And certainly we've found out that it's not just the public that we need to communicate with, it's also our other agencies that we're working with, it's schools as well, so that people are fully aware of what support, particularly in terms of welfare support, employment support, where they can get emergency food aid if they need it, or how they can get involved in things like the Sustainable Food Partnership and other groups if they want to be more active on this agenda. So, and also the Income Task Group have identified issues around loan sharks and targeting of specific vulnerable groups, and how we might want to support campaigns around that. So, there's lots that we'll be wanting to put in that comms plan.
Thank you, Kathy. Eleanor, you made a comment, I didn't quite catch it. Do you wish to remake it? Eleanor?
I'm not sure what the comment was, but I put in the chat
thing. The fact I'm a member of the SACRA, and I can certainly help you get in touch. I mean, it was the Imam who alerted us to the problem of Bengali-speaking residents. So I think that's a good idea as way forward.
Right, thank you, Eleanor. Ruth, did you want to make a comment?
Yes, hello. Just wanted to say thank you for Kathy for the report, and as I've been in the group, I've enjoyed the meetings and following it, and it was, as Vic said, rather well, the fact that it came together at a very useful time. The emphasis then obviously had to be on emergency food aid, and that is still, I think, very much the focus, thinking about the summer holidays and so on. So it's good to see that there are plenty of projects up and running, or soon to be. But thinking about the other aspect, that, looking ahead to the more sustainable food production, I think there have already been some links there. But I just wanted to say, so I think it's really important to work with the sustainability team at the council and outside, of course, with other partners, because the more food that we're able to produce locally that's of a good quality, the better, I think. And also looking ahead to what happens at the end of the year. So anyway, thank you very much for all your work so far. Thanks.
Thank you, Ruth. Anybody else wish to make any comments?
That's what to.
Right. Yes.
Yeah. Thank you, and thanks very much for the detailed report and action plan. It's really good to see, really exciting to see. The points I wanted to make were in relation to the actions around kind of lobbying for national change, and also ensuring that children have access to healthy and nutritious food all the way through the year. So it's, you know, it's been really good to see that we've had the announcement of funding for free school meals all the way through the summer holidays. But there's another ongoing campaign around the government's fruit and vegetables for infant school children, which is currently suspended, and we're not sure whether or not it's going to be reintroduced at the beginning of September. So, I mean, there's some national lobbying by Feeding Britain and others going on at the moment on that, so hopefully it will be confirmed. But I wonder if that also highlights a gap that potentially we could look at filling locally, and linking to what Ruth's just said about growing more of our own food. Can we work with school networks to grow food, or to allocate other food from elsewhere, so that more kids have got access to fruit and vegetables during the school day? So this is in addition to what they get as part of their school meal. So, you know, children aged 4 to 6 year olds having carrots and apples and that to eat at break time, which I know they all hoover up, and at the moment they're currently not getting. And linked to that, I wanted to thank our cabinet member Kevin for writing to the Health Secretary to flag out that issue and ask for the scheme to be reinstated. And then finally, linked to free school meals, I wanted to note that at the moment, some schools are not able to offer hot school meals. And I know that the school my kids attend will still be getting packed lunches as part of their school meals all the way through to Christmas. So I think we should keep an eye on that in terms of the quality of food that children are receiving. And with our more fragmented education system, what they're getting from their catering provision is very different across different sites, and it may not include fresh fruit and vegetables. That's it. Thanks.
Right. Good inventory of points there. Thank you, Jess. Rob.
Yeah, thanks for letting me speak, Chair. I appreciate it. Yeah, I think when this first started off about a policy and a strategy around food and everything like that, it seemed quite a simplistic task, really. And I think it's now demonstrated how vast and how wide the implications of this particular piece of work is. And I'm delighted with the leadership and the progress of this particular piece of work, and the collaboration for people around in the community. And I think it's a testament to the how people view this by the growth of the membership of the working piece. And just to try and give a little bit of clarity on the resource issue, I'm sure Kevin will join me in saying that we will do whatever we can to ensure that this piece of work continues to get not only the policy and the strategy, but I think this is one of the policies and strategies that is going to be done and not left on the shelf. Is going to have far-reaching effects on how we do a whole range of activities within our community and the way we support people, everything like that. So if there's going to be one policy that's going to define us at the moment, and I think this is going to be the one.
Thanks, Rob. Any further points from anyone? Don't see anybody saying anything. But one of the things is that we can set up policies and stuff like this, and often we do where there is a will to do such, but invariably they die on the vine because they don't have the financial support. So it's encouraging, as Kathy said, that of this 63 million, we've won 143 million. Now that I don't know how they work out how they give the money, but they're not going to give money to something that isn't showing itself to be proven. So I think that's the accreditation, is that it's won 443,000. Now, albeit that's got to be spent within 1 year, but if that's spent well, then that's the foundation for going forward. You've got a qualification that you can prove that you can do it with effect. So with that, I think there's a number of comments there that Mark will have recorded that makes a contribution towards the policy going forward, Kathy. And Becky, you don't have anything to add, do you, Becky?
I don't, thank you. No, I think both councillors and who's in support of it, and as Kathy's gone through it, has been incredibly helpful. And so thank you.
Okay, thank you to both, and we'll note and take account some of the comments going forward. So thank you very much. So we'll move on now to item 13. It's the director's briefing. I don't know, is that going to be who's going to present that? As I'm waffling here. Who's going to present that?
I can do
It's
it.
going to be you, Les, is it?
Okay, I can do it if that helps.
Yeah.
So you'll have, in Mike's absence, you'll have all have had sight of his paper. It's got 3 items on it and then the attachment. So there's the bit on working with Ofsted and DFE, which is just an update on what's been happening over the lockdown period, and Mary's articulated, as has Chris, some of that as well throughout this meeting. There's also the section on St Martin's Hospital and how we are closing that office accommodation, and staff are being consulted about that at the moment. We're working closely with CCG colleagues, considering our integrated commissioning arrangements, and it's most likely that we will be moving those staff in a different model and different way of working, because we've obviously been successful at doing this type of working during the COVID period. We want to consider that and how we can take that forward, but we'll be thinking about staff moving towards the Civic Centre or the Hollies. That's not confirmed yet, but the consultation is taking place. And then the final piece is the bit which is the attachment, which is in the community resource centres and the extra care housing support schemes that, as the panel knows, are coming back in-house to the council. And there's been quite a significant amount of work taking place around that, including the engagement with the staff groups, engagement with residents, and engagement with stakeholders and the wider community. And we are on schedule as planned to meet the deadline for when the transfer goes ahead on the 1st of October. I think that's all I need to report. If you've got any questions on that, I'll try my best to answer them, or Mary and Chris can also help with that.
Thanks, Les. Sirona then are handing it over in October, you say?
Yeah.
Did I read something or didn't I get it correct? I'm working from memory now. I looked at, is Sirona going to be involved for going forward from October onwards for a limited period, or is it a straight cut?
The Sirona will be involved for 6 months in relation to the operation of the bank staff that we'll need. So I think that's possibly what you're referring to.
Yes, it is.
Because the council doesn't currently operate a bank worker system, and to bring that, that's an opportunity for us actually to bring that kind of system in-house, but we need to work with Sirona in the first 6 months of the transfer in order to successfully do that.
Yeah, thank you. That's what I was wondering, yes. Any questions for Les? From anybody? Not seeing anybody. Right, so we'll take, we'll note that the corporate director's briefing note. Thank you, Les.
Councillor Malloy.
Ruth would like to speak.
Right, Ruth, sorry.
Yeah,
Yes,
sorry,
Ruth.
just a thought, thinking about care services in general, and what was published in the news yesterday about the government's new point-based immigration system. I expect you noticed that carers weren't included in the list of NHS health workers. So that just to flag up, that could mean that it may become more difficult to recruit carers looking ahead to next year. So the question is, yes, I'm sure you are aware of that, and would like to know what strategy you're going to have or develop to
Are you asking Les that?
deal with that. Anyway, thank you.
Right, thanks, Ruth.
Yes, and thank you, Ruth. Yes, it was a bit disappointing, if I'm honest, to see that had been decided. But just this morning, I did an email to the team that were leading on the Brexit arrangements going forward. So we've asked if that group could be stood back up, because it's been stood down for a period of time now, but make sure that we've got our workforce in a good place before that comes in, because you're right, that does put an additional pressure, and I'm particularly conscious of that coming in at the work that needs to take place during that period. So it will add another level of pressure to us, but we did quite a lot of work in advance with the care home providers and the home care providers in preparation for this, and we will re-pick that back up now, so it shouldn't be too difficult to pick back up. But yeah, we've just got to work with what we've got actually. But thank you for raising it, Ruth, and we did share it this morning to start it all up again.
So I'm bound to make a comment on this, because certainly what's always been pursued in looking through to social care is the cheapest labour we can get, no matter where it comes from. What the government's intention is, I believe, is to get a better paid service, so individuals, and get more professional status given to social workers or care workers, I should say, care workers, because it's always anybody, if you can't get another job, will go into care working, and that's why it's perpetually been low paid. And I think the aspirations of getting a career development for care workers and get a much higher profile, better paid, and attract some of our indigenous population, that when we're going to be faced with significant waves of unemployment, it's suggested it might be new openings and opportunities for people that they didn't realise before. But then I realise we're getting political, and that's what I don't want to do. So I'm going to stop there. No more comments on that. So thank you, Les. And so we're moving on to the last item on the agenda, the work plan going forward. Eleanor, I know that you are wanting to make some contributions to this. Can I call you in, please?
Yes, can you hear me?
We can, yes.
Right. We've mentioned the SACRE, that's the Select Advisory
Committee for Religious Education, which ever since I've been a member of it has reported to this scrutiny panel. I was wondering in September, since we've just published our annual report, if you would like a report from the Secretary, Dave Franson, about what we're trying to do. And this is very relevant because we persuaded the cabinet member to fork out a substantial amount of money for the development of the new RE syllabus, which is work we should do. And I think it would be a good idea if we could just briefly scope it out to you. However, the burning question I've got is why, when Baines agreed to make this payment on the 23rd of January, it took Bloom until the 10th of July to actually produce money so that we could start the work, which had been agreed and signed up as a sort of small print, the budget arrangements. So we are not happy with Bloom because it's delayed the start of the work. But we are moving forward now, and I'm suggesting we make a brief report to you in September.
Is that a report just for us to note, to make us aware of what's going on?
Yes, yeah.
Okay,
and what your money is being spent on.
Yes, I don't see anything wrong as in informing us, as you say, to where the money's going. And again, we have an agenda planning meeting. Michelle and myself, together with the officers, decide what the agenda is. You will note, Michelle, we both take the blame that there's quite an onerous agenda today. But then it was the cabinet questions that took the long time, and I see it that's the purpose of us being here, is to scrutinise and challenge officers at a senior level, and get the answers that we seek. And I think it's been done to good effect, although it's quite an endurance for us all on a Zoom meeting, but we seem to have succeeded there. Are there any other points that any member would like to put forward on the work planning? Any issues, Kevin?
I've got a couple of points, Vic, that is on my notepad from last time in some ways, but some are ongoing. To leave on as a footnote Operation Encompass, which I'm sure will just keep being updated, but Leslie asked me to keep it there. Secondly, the Culverhay site option, I think it's due for another check to see where we're up to on the Culverhay one. Yeah. It was mentioned the last meeting, maybe looking at something from the local authority as a corporate parent. and caring for looked after children in relation to the CSE exploitation in general that was raised. There was something about the Virgin Care update, which Leslie's already mentioned. The report that comes out 6 monthly or 3 monthly, I can't remember.
6 monthly. Yes.
The school attainment project, how that's going, closing the gap, and the autism board report was left on my notepad as well.
Right, quite an inventory there, Kevin. What we'll do is, because there may be other things that come along and that we're obliged to deal with, so we actually will get what we see as the biggest priority. All right, and Andy's just leaving the meeting, sorry, yes. So if we could leave that with Michelle and myself, and we'll try to introduce all of what you suggest, or certainly a good portion of it. Anybody else? No? Well, I'm going to take this opportunity now then to close the meeting on 2 counts. Is that we've done extremely well with all your contributions, and I've just about got a little bit of life left in my iPad now because I forgot to charge it. I'm down to 2%. So I'm obliged to close the meeting now. So thank you all very much for your contributions. Well done to you all. Thank you.